Okay, good morning. This is the Central District Board of Health meeting for Friday, August 21st. It is 8:30 in the morning. I will introduce myself as presiding chair. I am Betty Ann Nettleton, representing Elmore County, along with Representative Megan Blanksma. And as we've called the meeting to order, I will now take roll calls, starting with Boise County.
Boise County, Commissioner Stern present.
Valley County.
Commissioner Hasbrook present.
Ada County.
Jane Young present.
Ted Epperly present.
Lisa Lachiondo present.
Elmore County.
Representative Blanksma present.
Okay, thank you, folks. Now, under action item number 3, we go to changes, possible changes to the agenda. Russ, would you comment on that, please?
Yes, Madam Chair, we do have changes to the agenda, and it will need to be voted on by motion. And the changes include, we changed the meeting location from video conference that was at the top of the document to Syringa Room, which is where I'm sitting for the public to participate. And then also on a new business, item number 9 was changed to vote on rather than provide the cash carryover designations.
Okay, thank you, Russ. I would entertain a motion regarding the changes to the agenda.
Madam Chair, this is Commissioner Hasbrook. I'll make that motion.
Okay, thank you, Elf. Do I hear a second?
This is Commissioner Sturm, and I second.
Okay, Commissioner Sturm, and I second. Is there any further discussion? If hearing none, we will go ahead and take a roll call vote. Boise County.
Commissioner Sturm, aye.
Valley County.
Commissioner Hasbrook, aye.
Ada County. Ada County.
Ted Epperly, aye.
Commissioner Lacchiondo, are you there?
Aye. Commissioner Lachiondo, aye.
Dr. Young, are you there? Not hearing Jane. Maybe she fell off. Elmore County.
Representative Blanksma, aye.
Okay, thank you. Motion does pass, and we will institute those changes into our agenda for today under new business.
Madam Chair, this is Russ.
On. Yes, Russ.
Dr. Young is on. I'm not sure what happened for her not to be able to vote on that amendment to the agenda, but she is on.
Okay,
Sorry, my computer went out.
And the motion did pass the changes to the agenda, Jane. So sorry for the disconnect there for a while. Okay, the next item of business we move on to under new business is voting on the minutes from our August 11th board meeting. Are there any additions or corrections to those minutes? Hearing none, I will ask for a motion to approve those minutes.
Madam Chair, this is Commissioner Hasbrook. I'll make the motion to approve those minutes.
Okay, thank you, Elf. Do I hear a second for approval on the minutes?
Jane Young, second.
Okay, thank you. Any further discussion, or I will go ahead and ask for a roll call vote by county. Boise County.
Commissioner Sturm, aye.
Valley County.
Commissioner Hasbrook, aye.
Ada County.
Young, aye.
Ted Epperly, aye.
Commissioner Lachiondo, aye.
Elmore County.
Representative Blanksma, aye.
Okay, thank you. Thank you very much, folks. Those minutes do stand approved as presented. Moving on to number 2 under new business. This is a review of COVID-19 metrics for criteria for determining quarantine and restriction orders for Ada County by Kim Link, Communicable Disease Control Manager. Kim, thank
Madam-
you for joining us.
Madam Chair, can I say a couple brief statements before Kimberly begins?
You certainly may, Russ. Go ahead.
Okay, so we had modified the criteria that we had set in place on June 23rd, and it was updated for the hospital criteria. We had previously tracked emergency room visits, and our proposal, or basically what's been used today, is the hospital admissions for Ada County. So that's the change, but we don't yet have that data for a 2-week period. So we'll be using the emergency room data and some other indicators that Kim will describe. I just wanted to make sure the board was aware of that.
Okay, thank you, Russ. Kim, go ahead.
All right, thank you so much. Good morning. And I will wait for here we go, the criteria to come up.
Madam Chair, if I may, real quick, this is Diana.
Yes, Diana.
So while we're waiting for Kim's data to get up, I think just for the public's purpose, it's important to note so that, potential hospitalization for Elmore and Valley and Boise County are not also very, very important. But as we discussed during our last meeting, the hospitals within our district are sending COVID patients to Ada County because they don't have the ability to care for them in those counties. So I think it's a wholly appropriate data point, but I just wanted to clarify that for the public.
Okay, thank you, Diana.
Okay, thank you. And is it possible to get the document to be a little bit larger on the screen? That's a little bit difficult to read, at least for me at this point.
Madam Chair,
Yes, Megan.
I would just ask that we explain what document is coming up so those of us that don't have the capability to do the WebEx meeting and are on the phone can find a way to pull it up or at least reference our paper copies.
Thank you. I appreciate that clarification.
And I'm happy to clarify as well. So this is the document that at the very top states Ada County COVID information for Central District Board of Health. And the header on the page is Central District Health Ada County Criteria Summary. This is the first page of the document. And in this document, this will be something that will be routinely produced, provided to the Board of Health. At the top of this includes the current criteria. So you'll see under hospital that we're looking at current COVID-19 related hospital admissions among Ada County residents. As Russ had indicated, we do not have hospital admissions specifically for Ada County residents. As of yet, we are very close to being able to have that data online. The first disease report related criteria is reported confirmed and probable COVID-19 cases among Ada County residents. Disease criteria number 2 is no publicly declared illness clusters detected that may significantly impact illness levels within the community. And if you could scroll down, thank you. So for the analysis for this report, I should say this information is generated twice weekly. It coincides with the updates to our public dashboard, which are done on Mondays and Thursdays. The Monday report includes information that has been closed out from the week prior. Thursday information is a partial week report. So you'll see that the information in here includes partial information for the current week that we are in. And as we are looking at the 2-week trends that I'll discuss, those include 2-week trends, the 2-week period starting August 2nd. So we're looking at the weeks beginning August 2nd and August 9th. So for COVID-related admissions, since we do not have the specifics for Ada County residents who are being admitted to local hospitals, what we have available to us right now is information about total hospital census. So those people who are admitted to St. Luke's, St. Alphonsus, and the VA, those are the 3 hospital systems within our health district who are accepting COVID-related admissions. we have that information available. And what we're seeing right now is over the 2-week period starting August 2nd, there's a slight downward trend. As we look at the reported cases that are coming in, we are seeing a downward trend. However, we are still seeing in that 2-week period numbers that are going above 100 cases per day. So in the first week of the 2-week period, we did have a grouping of 3 or more consecutive days that went above 100. In the second week of the 2-week period, we had days that were over 100, but we didn't meet that, or we did not go 3 consecutive days over 100. So as we look at that, that is a good indicator, and I'll show this data here in a minute. And as far as illness clusters, we do have a number of clusters that we're keeping an eye on that have the potential and are impacting the community. And these include the Idaho Department of Corrections. That information, again, is being tracked separately on our public dashboard. We are still continuing to see cases among inmates and staff. We are continuing to track cases that are occurring out of the Ada County Jail. And also within Ada County, we have 38 long-term care facilities that have outbreaks that are ongoing as well. If you can move to the next page. So this slide here includes information about our hospital criteria. And as we look at this, it is being tracked both people who have been admitted to the ICU and people who have been admitted to the hospital but not the ICU. And again, this is information for our Ada County hospitals, not necessarily Ada County residents. And what we can see on the graph on the left, the bar chart, is as of yesterday, we were sitting at 54 people who are currently hospitalized in Health District 4 hospitals as a result of COVID. And this is the lowest that we've seen in a while, so hopefully this is a good trend of what we can expect moving forward. The right-hand side includes that 2-week trend. So again, we're looking at the week beginning August 2nd and the week beginning August 9th. And you'll see there the blue line is those actual numbers that are represented in the bar chart, and the gray dashed line is a trend line that's been applied to those numbers. And you'll see there is a slight downward trend. So heading in the direction that we want to be seeing. If you can scroll down to the bottom of the page. So for this bottom graph here, again, similar layout to what we saw above. However, this is looking at people who have been admitted to the ICU. And you'll see that our numbers have been a little bit more variable. Yesterday, the count was 15 people who were in ICU care in Health District 4 hospitals as a result of COVID. And then on the right-hand side, again, that's the same 2-week period. The blue line shows the actual numbers, and then the gray dashed line is our trend line for that. And you'll see, again, a very slight downward trend. So heading in the right direction, but I think we still have some progress to be seen there. If you'd like to move to the next slide, please. So moving on to the disease criteria, and this information has been broken into 2 separate graphs. This is similar to what I presented on during the last board meeting, where you will see that information is reported Ada County as a whole, and then the second graph that's presented excludes those inmates from Department of Corrections facilities. So as you can see here on the left-hand graph, so this is Ada County confirmed and probable cases by day of report over the last 4 weeks. And the blue portion of the graph are confirmed cases. The orange portion of the graph are our probable cases. And you can see that we do have a fair amount of variability in the number of cases being reported. Typically, Sundays tend to be our lowest report day. And in the past 4 weeks, we have had a large period of our time where we were well over 100 cases a day being reported. Many days we were over 200 cases a day. As I mentioned before, during the last 2-week period of time, so the weeks August 2nd and August 9th, we are seeing fewer days where we are over that 100 mark. And that's going to be one of our key things to keep an eye on as far as working through the gating metrics that were discussed at the last board meeting. So what we want to see is that in this 2-week period, we don't want to see any days over 100 cases being reported, or we don't want to see any 3-day periods really where there are over 100 cases. As you can see with the right-hand graph, again, this is looking at the trend information for the past 2 weeks. And the blue line shows the actual number of cases being reported. The gray dotted line is our trend line, and you can see a nice downward trend being reported in that data. So heading in the right direction. We still have work to go, though. And if you could scroll down. So this is the same information in the middle here. The same type of information being reported. However, this did take out the Department of Correction inmates, just knowing that they are a close congregate living population, that we can potentially see a lot higher rates of transmission occurring, again, just because they are in a congregate living facility. So taking that group of people out and re-looking at the data gives us an idea of what's going on in the community as a whole. And you see the numbers are indeed lower. When we look at the graph on the right, you see that trend line is not quite as steep. So within our community, we are seeing that cases overall are decreasing, the number of cases reported. However, that decline is not as rapid as if you were to include the Department of Corrections inmates. And the very bottom of this just includes number of cases by week. So as we look at our gating criteria, especially as we're looking at increases from week to week, it'll be important for us to look at the weekly numbers so that we have an idea of what that rate of change is. And if we are seeing an increase from one week to another, whether or not that rate of increase is more or less than 50% of the week prior. And again, we are fairly consistently seeing decreases in these numbers over time. You'll see that last number there, the 298, that's the current week's data. And like I mentioned, that's a partial week, so that will continue to fill in over the course of this week. Our weeks run from Sunday to Saturday. So by the time that the Monday data is updated, that information will be fully filled in, so we have an idea of where we're sitting for the current week. And if you could go to the last slide, please. So this last slide does not include information specifically toward our gating criteria, but again, we were using syndromic surveillance information as part of our decision-making metrics previously, so we felt that it would be good to include this as well, just as additional information, and again, so that we have that opportunity to look at another indicator of healthcare utilization while we are waiting for that Ada County hospitalization information to become available. So this is our people, residents of Health District 4, so this is district-wide, residents of Health District 4 who are presenting to local emergency departments with the COVID-like symptoms of fever, cough, or shortness of breath, so the more severe type COVID illness. And you'll see on the left, those are our daily counts of ED visits. On the right, it is, again, that similar 2-week trend, weeks of beginning August 2nd and August 9th. Blue lines are our counts, the gray dotted line is our trend line, and you'll see that we do have a slight decrease in or a slight decline in the number of people who are presenting to the emergency department. So again, that indicator is heading in the right direction as well. And then the bottom portion of that graph includes our weekly counts as well. We were looking at that data both daily and weekly. So I'd say that is the summary of the current data. Overall, I would say that our illness counts, our hospitalizations are both headed in the right direction. I think we still have work to go. One area, we are keeping a very close eye on what's going on in the community as a whole, and areas where we know that there may be opportunities for rapid increase in the number of cases. And of course, with Boise State students arriving back here, those classes starting back in session, we know that there are some private K through 12 schools that are coming back into session as well, that those are going to be areas that we're going to keep a very close eye on and really work with university and school administrators, not only through the planning portion, but also if there are cases that are being detected, so that we can rapidly contact trace and try to keep any cases from becoming clusters or outbreaks. And that's the end of my report. I'm happy to take any questions.
Madam Chair.
Kim, questions for Kim? Megan? Go ahead.
This is Diana, actually.
Oh, I thought, okay. Go ahead, Diana.
Kim, would you go back up to the hospitalization slides? So this is, I'm wondering, are we trying to home in on Ada County residents or District 4 residents on this? And this is where this gets really difficult. Well, it's all really difficult, but we know, so first we know that within our own district, patients are being cohorted in Ada County, but we also know in the Treasure Valley, because it makes sense from their business perspective, hospital systems are shifting patients, right? So they may be cohorting in Boise when they have less patients, but they also may be having to transfer patients when their ICU's full in Nampa, for example. So this is where it gets really difficult because our public health measures may not have an impact on obviously on those residents from other areas. And yet it will certainly potentially change what we do or don't do here. So I'm of sort of two minds of this. You know, on the one hand, I want to make sure our public health orders are affecting what we're doing here. At the same time, I know that regardless of where somebody is coming from, if we run out of capacity in our hospital systems, it affects our residents as well. So what are you thinking about, Kim, in terms of how we look at this?
Well, I think that there are two ways to look at this, and you're correct in terms of looking at this. And to explain what these graphs are looking at, again, these are number of people who are currently hospitalized in St. Luke's, St. Alphonsus, and the VA, the facilities that are located here in Ada County. So it does include patients who are Ada County residents, but it also includes patients who are residents of, say, Canyon County or any other area that they may be taking in patients from. So this is really an indicator of what our current hospital capacity is looking at or what our current hospitalizations are. It is a stepping stone toward what we are looking to ultimately be providing. So I am hopeful. We've been working very actively with all three of the hospital systems to be able to get that specific Ada County information. I think it sounds as though we are on track to be able to start receiving that as early as next week. I don't think it will be available for Monday's update, but I think that we may be able to start seeing data by Thursday. What I would like to do in terms of providing information moving forward once that data comes online is to be able to show the trend information, so have a graph and a trend line for Ada County residents who are hospitalized, and then also show this overall hospitalization information so that you have an opportunity to see not only what is going on among Ada County residents, but then also have that visibility among all three hospital systems of what their overall hospitalization census is looking like at the time. And I think that gives a better snapshot of what's going on in our community, but then also how it's contributing to the overall hospitalization picture.
Madam Chair, this is El.
Yes, go ahead.
Kim, I'm just wondering, we got a lot of people that come in and see the doctor, not in an ER situation, that are diagnosed with the COVID and then they go home and, try and live through it, are those people being counted as well?
So to clarify, do you mean that people who would see the doctor and not get tested?
Well, they test positive and they're sent home because they're not that sick. Does that make sense?
Okay. It does make sense. And those individuals are going to be counted in our disease indicators, so those confirmed and probable cases.
Okay.
And yeah, as we look at those, our confirmed cases are the people who have tested positive by the PCR testing. Probable cases are going to be their close contacts who don't get tested, and those are also going to include people who have tested positive using the newer technology of antigen testing as well.
And then I had a follow-up question, maybe for Diana. Do we know what's going on in the IC units in the other districts and their hospitals? Are they, like in the Napa Caldwell area, are they actually full and extreme and overloaded and have to ship folks out?
So I don't think that's happening right now. It has happened though. So and we don't have hospitals on with me, but Kim, you can tell me if I'm totally wrong. But my understanding is that they have at various times in July had to shift patients from Canyon County to Ada County. But then also what goes on is kind of depending on what's happening, they may cohort patients. They may put COVID patients all in Ada County because it's easier for them because of the amount of PPE required, et cetera, to take care of people all together. So it might happen for either reason.
And I'm assuming that's the reason they're going to the veterans as well, because they're a vet from out of county and that's the place to go.
Yep.
It kind of skews the data a little bit.
Well, I think this is, you've sort of heard my kind of increasing, I guess, frustration be the term on this, that, we've implemented a lot of measures in Ada County and rightly so. But ultimately, if we have disease rates and case rates that really start to spike in other counties, it's going to affect our hospital capacity. And two things, it's going to affect our residents' ability to access care for anything else, but also it's going to affect our ability to move out of stages potentially because of the numbers. So it's like everything else, it's challenging.
Yet again, this is Ted Epperly.
Yes, Ted, go ahead.
Yeah, thank you. I'm pleased to see the numbers starting to decrease. And I think, quite frankly, that has a lot to do with the steps we've taken. The increased face mask wearing across Ada County, Valley County, our closing down of bars and nightclubs, our comments on social distancing. All of these, I think, are really beneficial. So the question becomes, Kim, to you, is this a result of our steps, or is the background burden of coronavirus in our community less? And with that said, one piece of data that we've never really focused on that might tell us that is the amount of coronavirus that's being processed and measured through our sewage waste disposal plants. Coronavirus is actively excreted from the human body as well. And I'm just wondering, have we any data points in regards to what's happening at the sewage waste disposal plants in terms of the volume of coronavirus in the community? Because one thing we're going to have to be able to really understand with this is, yep, it's great to see decreasing numbers, but I have a feeling that a lot of that is due to our intervention, not necessarily that coronavirus is less in the community. So is there any data that we have that helps with that, or that we could actually start looking at in some way so that we all have an understanding of how much actual coronavirus there is in the community?
That's a great question, and that is information that and data that we are not collecting at Central District Health. However, the City of Boise is doing wastewater monitoring, and they have a dashboard that they've published that includes that information. We're collaborating with them to pair that up with case-related information so that a person can look at that information and have a more full picture of what's going on in terms of reported cases, cases by date of onset, and then also how that wastewater looks. And that includes, that wastewater does include residents of Boise, Garden City, and Eagle are all contributing wastewater to the processing and the surveillance that's going on.
You know, it might be wise for us to contemplate how we might use that data in some way, only because, you know, we're charged with the responsibility of kind of giving the all clear sign, if you will, and we'll do so on decreasing cases. We've got our definitions of what decreased burden looks like in the community. But if we take away those important public health measure steps like face coverings, social distancing too soon, and we don't have an indicator that the amount of virus being processed at wastewater plants is less, we'll just be reintroducing people to new infection. So it might be wise, Kim, we certainly don't have to decide this today, but maybe for you and Russ and the team at Central District to talk with the City of Boise folks, maybe Diana can be helpful in terms of how do we take a look at some sort of baseline data so that we can get a sense of what's happening with the actual amount of coronavirus in the community, just as an additional thought for us. Because again, if we take away the public health measures too quick and the virus is still active and present in burden in the community, we'll just see cases go back up.
Madam
I
Chair,
think that's a great point.
Yes, I don't know who's speaking. If you'll identify yourself, please.
this is Jane,
Yes, Jane, go ahead.
and I've got two questions. One is, Dr. Epperly, the amount in the wastewater, how does that relate to the number of cases in the communities?
Jane, Madam Chair, this is Ted, if I can.
Yes, Ted, go ahead.
You know, Jane, it's a good question, and I really don't know. What I think I know is that there is an active amount of coronavirus excreted from the human body in people who have active cases. And so if we can also track some sort of mechanism of the amount, it would be wonderful to see as we see decreasing cases, both in the hospital, in the public, through the emergency rooms, as we see those cases decrease, if we can corroborate that there's a decreased volume at the wastewater disposal plants, we'll know it's true, and related. If we see decreasing cases, but the number and the amount at the wastewater treatment plants have not decreased, then we know that there's still a lot of coronavirus in the community, so that if we lessen and lower the restrictions, such as we're down now less to 25 cases per day, we stop social distancing, we take away face mask mandates, and there's still a lot of coronavirus being excreted, we know that what's going to happen is that those cases will go back up. So I think there's a direct correlation, Jane, to answer the question, between what's being excreted and the actual burden in the community that may be falsely understood by cases decreasing because of our interventions of face mask wearing. So that's, I think, the connection that I think we just need to be careful about. We can be falsely reassured that case counts are going away because the virus is going away, when that may not be the case.
Thank you.
Madam Chair, this is Representative Blanksma.
Yes, Megan, go ahead.
I just have a quick question for Kim. Kim, you had this criteria summary here for 820, and last week I asked you to provide a similar outlook, or I guess a look back at every decision point when orders were instituted to look at the analysis of the data versus the criteria. And I haven't seen anything from you yet, and I just wondered where we are with that.
That's a great question. I think the honest answer is that I misunderstood what you were asking for, and that's something that I'm very happy to pull together for you and can have it available, I would say by Monday, if that works.
Well, I guess it will have to. I was hoping to have it for this meeting, and I didn't receive anything in response to my request. And so that has me a little frustrated because I would have liked to have seen it.
Okay, is there any more discussion or questions for Kim? Well, Kim, hearing none, I thank you for your report, and we will move on to number 3, which is a review of the open meeting law investigation report and response to recommendations by Russ Duke, District Director. Russ, go ahead.
Okay, so there was a report of alleged violations of the Idaho open meeting law that was submitted to the Ada County prosecutor by the Idaho Freedom Foundation. It was sent on the letter on June 29th, alleging that Central District Health Board of Health violated the open meeting law on June 20th, 2020 and June 26, 2020. In that report, in the recommendations section, there were several recommendations. Actually, there were, 7 recommendations. One of those was to have the board members participate in open meeting law training, which we're going to do next. The other recommendations really had to do with ensuring that we followed the open meeting law, and especially around posting the meeting notices on our website and physical location. So I just wanted to make the board aware that we have established an internal policy, and that is being used now. It's 3 people deep, and that would be for the various types of meetings, for the special meetings or regular meetings and the emergency meetings. So we feel like we have everything in place now and have the staff ready to go, so that we won't be in violation in regard to future meeting announcements and agenda items.
Hey, Deanne, this is El.
Yes, go ahead.
Yeah, Russ, it sounds like you guys are taking steps to kind of fix the problem. Believe me, a lot of us have been in this similar position in other meetings and other commissions that we're on, and it's an oops things, but we've all learned from it, and it's not world ending. We fixed it, and I think we can move on. So great job in getting a system set up to double check and make sure everything is done correct.
Okay, thank you, Eld. Russ, do you want to move on with the training issue at this time? Or?
Sure, I'd be glad to. So Brian Kane has joined us. He's from the AG's office. And I just want to apologize for there's a lot of echo, because I am in the room where the YouTube is being broadcast for members of the public to watch. So we got it turned down a little bit, but I'm sorry about that. Anyway, so Brian Kane from the AG's office is the person who will be conducting the training for the board members. So I'll let him or introduce him, and he can take over. And I think it's going to be around a 45-minute to an hour training is what I was informed about, and we'll let him start.
Okay, thank you, Russ. Go ahead, Brian.
Sorry, I guess I'm just a little overeager. Too many cups of coffee this morning. So we're here today to talk about the open meeting law, and I want to let you all know that we actually have been forwarded another open meeting law complaint regarding the Central Health District Board, and you probably noticed that you had to change the way that you're conducting your virtual meetings, and the reason is that under the statute, when you conduct a virtual meeting, you have to have a location where people can physically come to and observe the meeting, and there has to be at least one board member or executive director in the room with them. And so the governor, in the course of his orders, had suspended that requirement for a time period that expired. From what we can tell, it expired around June 26th or maybe July 1st. We're not entirely sure what the date is of the actual expiration. But whatever that date is, we're well beyond that. But we also recognize that the fact that expired, that provision expired, has not been broadly publicized or anything else. And so I just want to make sure you know that we're in the process of that. And I can tell you that based on our training today, we're essentially going to wrap that up into this training as well. And so hopefully by the end of this, you will all have what I like to think of as a clean slate moving forward. But I do want to say, and maybe hopefully we can get that PowerPoint pulled up fairly quickly here. But I do want to say that based on, next slide, based on where you're at as a board and kind of the publicity around what you're doing as a board, this is one of those time periods where you all really are kind of under a microscope, meaning you've got groups of folks that are very closely watching everything that you do. And I would even hazard a guess that there's a group of folks that don't like the way that don't like the outcomes of some of your decisions, and therefore they're looking for the means to challenge those decisions. And so, yes, at times you may feel like this is really technical, and at times you may feel like this is a little bit unfair, but it also is how you protect the decisions of your board to make sure that they can't be challenged. And so I think that, to me, this is the ounce of prevention, because you don't want to have to go through this cure process or continue to go through this kind of complaint and response process. Our office publishes manuals on the open meeting law, and this is the cover of our open meeting law manual. It's available on our website. If you want copies, we can produce hard copies that we can send to you, and that kind of helps you work through everyday problems. It's got a Q&A section as well to kind of work through there. Next slide. So one of the first things that I always like to talk about with folks is the open meeting law is one of those statutes that, in my experience, when I've seen boards kind of try to fight the open meeting law, they really struggle and it gets really difficult. Whereas if they embrace it and just say, you know what, we're going to embrace openness, we're going to be as open as we can, and we're going to go above and beyond what the open meeting law requires, then they really lose a lot of attention. And I think that, to me, one of the key takeaways with the open meeting law and government that I have observed is the more an entity tries to not comply with the open meeting law or say that this meeting isn't subject to the open meeting law, the more interest that generates than government entities that just comply with it. And part of it is that government, by and large, is really a pretty boring endeavor. And so I think that, one of the things that I've noticed is it's more often that you will have properly noticed meetings with very few attendees as opposed to if you try to avoid the open meeting law, everybody and the press's cousins want to get into that meeting. And so I think that that's something philosophically to think about. And that also kind of philosophically is consistent with, the legislature's directive that the policy of the state is that the formation of public policy is public business. Next slide. So as we go through this, we're going to go through a few definitions, notice and agenda requirements, how the meeting is conducted, executive sessions, and then enforcement. Next slide. So as we go through definitions, it's always important to remember that the legislature kind of sets the rules here. And so if you have a definition in your mind of what something is and it doesn't match up with the code always controls. And so if the legislature says this is how the word is defined, that is always the definition that controls whenever we're in some sort of statute. Next slide. So the first definition under the open meeting law that's really significant is decision. And so any determination or any measure that you're going to have a vote on through the governing body is a meeting, you have to have that under the open meeting law. And so anytime you're going to make a decision, which means just a vote on any measure, including, for example, your approval of the minutes before, that has to be done at a meeting. And then you've also got the quorum requirement. That you may read that and think, that's a pretty tight definition. There's a lot of things that probably we do that wouldn't necessarily qualify under that definition. That definition is significantly broadened by the next one, which is deliberation, the receipt or exchange of information or opinion relating to a decision, but shall not include informal or impromptu discussions of a general nature. So two things out of that definition. Number one, if the information you receive puts you on the road to a decision, that should occur within an open meeting. That also means that there are certain types of gatherings and discussions that wouldn't fall under the open meeting law. And so, for example, say as a board, at some point in time, we're allowed to socialize together and you want to go to lunch after a meeting. You would absolutely be allowed to go to lunch after a meeting as a board, provided you didn't discuss board business. And so the one thing to always keep in mind is it's not can you go to lunch as a board? The question is, do you have self-discipline to go to lunch as a board? And the reason why I say self-discipline is because as a board, the thing that you have in common is the work of your board, which means that whenever you get through what your small talk agenda, which is, have you gone on any vacations, seen any movies, what's your quarantine board game of choice, whatever it is. Once you get through those sorts of preliminaries, there's always a pause point. And generally, after the pause point, you're going to start talking about that thing that you all have in common. And the most common thing is that you're going to start talking about work. And so the real question is, can you get through that without bringing up that discussion? There's also a perception issue, right? And so if you're a board, and you, for example, decided to have breakfast right before your meeting, every time you have a meeting, well, folks are going to assume that what you're doing is you're pre-planning your meeting. And so, again, there's a little bit of a perception issue there as well that you have to be aware of as a board. Next slide. Public agency, I'm not going to go through this definition, but I do want to highlight down here at the bottom the last few lines where it says any sub-agency created by or pursuant to statute, executive order, ordinance, or other legislative act. And so if you create a subcommittee of your board, that subcommittee should also be subject to the open meetings law. Next slide. Here, a governing body, you clearly fit this definition. It's any public agency consisting of 2 or more members with the authority to make decisions for or recommendations to a public agency regarding any matter. Again, the fact that if you think back to that last slide, subcommittees fall under this because they generally make recommendations to that governing body. And so that's yet another example of how those subcommittees probably should be coming under the open meeting law. And then a meeting is, this builds in all of our previous definitions, right? convening of a governing body of a public agency to make a decision or deliberate toward a decision on any matter. And so all of the decisions we just covered are built into that definition of meeting. There are two types of meetings, regular and special. Next slide. A regular meeting is a meeting that requires at least 5 calendar day meeting notice and 48-hour agenda notice. The one exception to this is if you're a board that meets like the second Tuesday of every month or every Monday, you can actually publish a schedule of all of those meetings in January, and then you just have to comply with the 48-hour agenda notice. And then special meetings, you have to give at least 24-hour notice unless an emergency exists. And to me, you have to be able to identify an actual emergency. It can't be we forgot to put up the notice. And so I think that that's important. One thing to always keep in mind is that with special meetings, the press can request to be on a list that the board has to then maintain. And anytime you have a special meeting, you have to make sure that the press is notified of that meeting if they're on that list. Next slide. So one of the newer provisions is that you now have to make sure that your notice for meetings and agendas are posted electronically. And so if you have a website or a social media platform, make sure that that notice is posted there. The one thing I would recommend with regard to this notice provision is make sure if you've got a website that it's posted like on the front page of the website. I've had a number of complaints that have come through our office recently involving boards that have posted it online, but it's really difficult to find that notice because it's like under an About Us tab or something to that effect. And so if you're posting your meeting notice, make sure it's prominent and kind of front and center. Next slide. You can have an executive session only meeting, and that requires a 24-hour meeting and agenda notice. And it has to, again, this is kind of consistent with the executive session provisions. It has to state the reason and specific provision authorizing the executive session. Next slide. Agendas are required for each meeting. They're posted along with your meeting notice. So you post your agenda both at your place of business and online. You're allowed to make good faith amendments to the agenda. And for example, this morning, you kind of worked through that agenda amending process. And I note that the agenda that's posted is amended, and it looks like it was amended a couple of times as well. So those are all okay. You just want to make sure that you comply with that process to make sure that it's posted properly. Agendas are required to include all items of probable discussion. And so you can't have an agenda that just says old business, new business, adjournment. Believe it or not, this year I actually had one of those agendas cross my desk. They're still out there. I feel sometimes like I'm on a one-man crusade to find all of them in the state of Idaho. And we're still doing it. But one of the things to keep in mind is you want to give enough notice to the public that they can understand what's going to be discussed, but you don't have to, put down an entire digest of what is going to be discussed. One of the things that folks like to argue about is whether or not the agenda is sufficient. And so just keep that in mind as you're putting together your agendas. Next slide.
Question?
Yeah, go ahead.
I'm a commissioner from Valley County, and our issues usually run into last-minute agenda items that are added right before the meeting. And I'm not sure what the code says. I think if it's an emergency situation, you can do that, but to add something the morning of the meeting, you can't do that. Is that correct?
So you can add it. You just have to have a good faith reason for why it wasn't on the agenda previously. And so what you would do is you'd come into the meeting, and I think that at the beginning of your meeting, I think one of your agenda items was additional agenda items. And so if you've got stuff that needs to get added on, you would immediately there say, hey, Mr. Chairman or Madam Chairwoman, I have this item that needs to be added onto the agenda. The reason why it needs to be added onto the agenda is because, and so I would move in good faith that we place this on the agenda. And then the board votes on it. And the whole key there is to allow the public as much notice as possible of what's going to be discussed. And I think that that's really important. And I think, one of the overarching things within the open meeting law is the open meeting law provides citizens with the ability to observe their government in action. And this is really important because I think that sometimes folks forget about this. The open meeting law only guarantees that right of observance. It does not create a right of participation. And so if somebody shows up at a meeting and says, hey, I want to tell you all the reasons for why masks infringe on liberties worse than seatbelts, for example, you don't have to hear them out. Unless you have a part of your agenda that's like an open forum or, constituent interaction, whatever you want to call it. Well, if you have that on your agenda, then you probably have to allow all comers to testify. But you can also set reasonable limits on it, right? You could say each person gets 3 minutes or each person gets 5 minutes. But it only guarantees the right of observance. I actually casually refer to the open meeting law as a ticket to the show of government, right? And so if Broadway reopens and I went and saw Hamilton, I don't get to jump up on stage and join King George in singing. And so I think that that's one of those things to keep in mind is you just get to watch government, which again, as you think about kind of how things unfold, that makes sense. And the whole key of these agenda and notice provisions are to enable folks to see those portions of government that they're most interested in.
Madam Chair.
Yes, who's speaking, please?
Sorry, this is Diana Laciondo. Brian, I guess
Diana, go ahead.
I'm putting this in a practical lens with what we have going on currently and this issue of having a board member, having Russ physically in the room with people who want to watch and knowing the folks who generally have been showing up. They have been showing up not wearing face coverings and often for the purpose of disrupting the meeting. And so I guess, I'm sort of struggling because with our YouTube channel, we are now more open than we've ever been. And, you guys have heard me joke in the past, like we would get one person to come to our meeting before when it was on septic tank approvals. But it's been fantastic that we've had 500, 600 people watching online. And so I'm struggling with how do we balance that going forward? And quite frankly, from a liability perspective, even on our end, protecting our staff members, both, kind of really physically on multiple different levels, whether someone's there for the purpose of being just disrupting the meeting, if they're interested in causing physical harm, or now we have a highly contagious virus and people who really don't like masks and could be exposing one of our staff members. So this is a challenge, and you guys know this from the beginning of what the governor's emergency recommendations were. And I'm struggling as a board member trying to figure out how we're gonna rectify those things.
Sure. And I think that, to me, you still have all of the tools you need to control your meeting, right? You have the ability to require all attendees to wear masks, particularly since you actually have a mask order in effect, if I remember correctly. Number two, you have the ability to say, we're in a room that is this big, we can handle X number of board members and X number of the public to observe. Right. And then the other thing is, if people are disruptive, you can have them leave the meeting. Again, you only have the right to observe the meeting. You can, kick folks out that are disturbing the meeting. And I think that those are all things to keep in mind that you have. And it could be the sort of thing that, for a little while, maybe you need to meet with whatever the appropriate police entity would be for that to provide some additional security. And I know that every one of these decisions contains an overlay that you have to think about within government as to, what the image is that you're projecting and all of those things. But all of those tools are available to you. And, one of the things to always keep in mind, and we haven't gotten to this slide yet, but the the remote meeting provision of the open meetings law was put in there before we had the capability of things like Zoom, where you can see every single attendee through a fairly stable video platform at a meeting, right? And so the whole point was we didn't want the legislature didn't want to have citizens essentially coming to empty rooms with a speaker box in the middle of the floor and saying, well, there's the meeting. And I think that, you know, that dynamic has somewhat changed. Now, I mean, I don't know if the legislature would be amenable to an amendment of that provision, but, you know, the dilemma that we've got is we've got this law that says you have to have someone physically present there, right? And I think that, you know, one of the things that I've heard is that, you know, folks don't want to allow for boards to get too detached from the constituents that they represent. And so, I mean, that is another factor to kind of think about as you evaluate how you handle these sorts of situations. I think that, but I think that all of those things are worth discussion within the board, right? How is it that you want to conduct these? Who is it that you want to have, you know, physically present? How many people are allowed in the room? Those sorts of things. Does that answer your question?
It does. I think I'm just sort of, I'm playing this out practically, right? We have a meeting, people demand per open meeting law that they get to attend, but they also say, no way, hey, am I wearing a face covering? So you have two laws butting up against each other, and that provide, you know, that's a really challenging situation. And I'm concerned about our staff. That's another liability, right? Russ gets coronavirus because whatever, then what's our liability there? So we'll have to talk through it.
Sure. And I think, I mean, the other thing to think about is providing notice of those factors, right? And so if you look at your agenda for today, right, a couple of things that you could include both on your meeting notice and your agenda is, number one, in-person attendees are required to wear masks. Based on the room capacity, we only have room for 10 attendees. Once that limit is reached, you will be offered either an overflow viewing room, or you can observe the meeting in its entirety at this web address, whatever, right? And I think that, you know, the more notice that you can put out there, the better it's going to be for you all as far as both functionality and not subjecting yourselves to kind of unfounded claims, so to speak. And I think that those are all steps that you can affirmatively take to kind of work through this process. So as you, and again, I mean, we're still on agendas. One of the things that you have to have within your agenda is you have to identify all action items. And so you can't take, you can add an action item onto the agenda after the start of meeting if it's an emergency. And so I think that this may have been some of the confusion between between just amending an agenda and adding an action item. The agenda can be amended for a good faith reason, but if it's an action item, it has to be an emergency reason, meaning we have to make this decision or something will happen. And so I think that that's something to keep in mind when you're looking at your agendas. Next slide. All meetings are of a governing body shall be open to the public, and you can't hold a meeting where discrimination is race, creed, color, sex, age, or national origin is practiced. I don't think this is really a problem. The big things that occur within this area of the law is sometimes folks will have an open meeting, but people can't find the meeting because the door is shut or something like that. Or folks, one of the things that we've actually had happen, and weirdly, this happened at one of our Idaho for Open Government seminars that we do with the press and elected officials and everybody. We had our meeting in a gymnasium, and we didn't observe that the gym door swung shut and the door actually locks from the outside. And so folks we're holding an open government session, and we realized about 3 or 4 minutes in that the door was actually locked to the gym. And so then we had to figure out a way to keep it open. But those are things to really be aware of. And Idaho is a small state, and so sometimes it's very difficult to find spots to hold meetings. And so, we've gotten questions on everything like, can we hold an open meeting in my house? to can my church host a meeting? And I think we actually had a scenario where in northern Idaho, a bar hosted a meeting at one point. Those things all carry with them decision points that you have to consider, right? People who don't know somebody don't necessarily feel comfortable walking into someone else's house, particularly not just walking in like you would envision an open meeting. People of different religions maybe are a little bit unsure of walking into someone else's church. And then the same thing with a bar. And so all of those things, you have to really sit there and make sure, is this truly open to the public, and make kind of informed decisions in that matter. Next slide. So we just kind of talked about this. Meetings can be conducted using telecommunication devices, but it does require that you have someone in the room and kind of a location for the meeting where people can show up and say they're attending the meeting. Now you can, things that you can do, right? You can have social distancing, you can have mask requirements. If you want to have whoever your in-person board member is behind like a plexiglass screen, all of those sorts of things can occur. This also means that you can't, use computers or text and conduct private conversations about board business, because that defeats the entire purpose of the open meeting law. And I think that, one of the pause points when you go all virtual is, can you actually see everything that's going on within a meeting? And, one of the questions that has come up as we think about, how and I'm just going to let you know this, right? One of the questions that comes up with the legislature, right, is the legislature thinks about how it's going to meet. Remember, Idaho Public Television streams those proceedings, but you don't see the entirety of the proceedings on the Idaho Public Television screen, right? Because they only show you generally the people who are speaking. And so you can't see any of the other activity. And sometimes the more important part of a meeting is the unspoken communication that's going on, right? And that's, and so I think that that's one of those things that, like, when you're thinking about the conduct of a meeting, can you actually see all of and observe all of the proceedings of the meetings? And that's one of the big question marks as you move through telecommunication or virtual or all of those sorts of things. Just things to kind of think about in that context. Next slide. You have to provide for the taking of written minutes of all meetings, and the minutes should be available to the public. At a minimum, they have to include all members present, motions in their disposition, and the results of all votes. That's the bare minimum. If you want a good example of what minutes should look like, the Idaho Legislature committee minutes are great examples. If your minutes look a lot like theirs, you'll never have any problems with minutes. The one thing I will add is you have to have written minutes. And so I noticed, for example, that you all have a YouTube channel and you have your old meetings on there. Those old meetings, while great and a fantastic public service, do not take the place of minutes. You still have to have minutes of those meetings. Next slide. You are allowed to have executive sessions where members of the public are excluded, but only for the purpose and only in the manner set forth in this section. And I will tell you that I actually noticed a little kind of catch-all on the bottom of your agenda that I'll discuss with your attorney and board secretary, because you can't have a catch-all you can't have, like, you never know when we're going to go into executive session. It could occur at any time. That's not permitted under the open meeting law. It has to be a specific reason for we're going into executive session to discuss this topic. And so when you go in, it has to be by a roll call vote and recorded in the minutes, and it's authorized by a 2/3 vote of the governing body. And so you want to always make sure that you follow each one of those procedural steps as you go into an executive session. Two things that come up over and over about executive sessions. Number one, who gets to come into an executive session? The answer is you, the board, decide who comes into an executive session. But as you think about who comes into an executive session, I have to share with you the wisdom of Benjamin Franklin. The whole point of an executive session is that you're dealing with information that is meant to be kept confidential. Benjamin Franklin said there's only one way to keep a secret among three people. Anybody know what the answer is? if 2 of them are dead. And so keep that in mind, that the more people you bring into an executive session, the more difficult it's going to be to keep that executive session confidential. And I am not by any means advocating the killing of all other attendees of executive sessions. I'm just saying keep them small. And I think the corollary to that is you want to keep your executive sessions small, but you also want to keep them brief. And you probably recall over the news that we had a fairly public scenario where there was an executive session that went over 2 hours and it spanned a huge number of topics. If you have a long executive session, the likelihood of you drifting from the original topic of your executive session substantially increases. And so the advice that I offer is to keep your executive sessions small in number of attendees and brief in time of conduct. And so if you keep it kind of small and focus on that, less is more, you will have much more effective and defensible executive sessions. Next slide. So here, I'm gonna run through this fairly quickly. But the one thing I want you to observe as you go through the reasons for executive sessions is there are no general executive session permissives, meaning you don't get to go into executive session to discuss vacancies generally, if you look at A. It's to fill a particular position with a particular person, right? Same thing under B, evaluation, dismissal, or discipline, or hear complaints against a specific person, employee, staff member, agent, those sorts of things. There's no generalities in there, right? And you know, one of the things that we've heard in the past is we went into an executive session to discuss why people that's not a permissive use of an executive session. And so I think that, you know, to me, anytime when you're planning for an executive session, if you can point to something specific that you're going in, it's probably defensible. If it's more general, then you're going to have trouble within that with defending the purpose of that executive session. Next slide. And just kind of continuing, right, to acquire an interest in real property. You should be able to, although you're not going to disclose it, you should be able to identify the piece of property you're considering, right? Records that are exempt from disclosure. There should be actual records that are there. Next slide. Legal counsel for legal ramifications and legal options for pending litigation, right? You should be able to identify either the case that's already been filed or a case that's likely to be filed. And then the same thing, next slide. Same thing with your risk management, right? You should be able to identify the claim or the claim that's likely to be filed. And I will admit to you that I keep clicking my mouse because I keep thinking I've got control of this slideshow. So I'm used to old habits die hard, I guess. Next slide. You can imagine my frustration when it's not working. So the other thing to keep in mind, and again, this is a practice tip for you. If you think about how you build confidence in those executive sessions, right? The number one thing to remember about how our minds work is that in the absence of information, our minds have a tendency to fill the blanks in with negative outcomes and negative conclusions. And so if you think about an executive session, right, that's something that the public is excluded from. And so their natural tendency is going to be to fill in the blanks with some sort of the board is doing things they're not supposed to be doing in there, especially if the sessions become long and frequent and those sorts of things. So one of the things that I always like to offer to boards is one of the ways to kind of help you self-regulate your executive sessions is within your minutes, timestamp your executive sessions. And so, for example, I think you have an executive session on the agenda today. If you go into that executive session, say at 10 o'clock a.m., entered executive session to discuss evaluation of candidate, and then have at 10:15 a.m. exited, adjourned from executive session following discussion. And that way, you haven't disclosed any information of what's gone on in that executive session, but you've also informed the public, hey, we took about 15 minutes to evaluate that candidate. And that enables an external observer to say, you know what, sounds like they're getting down to business and doing exactly what they should be doing. And it also serves as a check on yourselves within that executive session if you know you're somewhat on the clock. That kind of helps to limit it. Which goes right into this next slide, right? It's a violation of the open meeting law to change the subject within an executive session to one not identified. And that's something that's really easy to do. We had an example where folks went in to fill a vacancy, and during the filling of that vacancy, the observation was made, well, out of the 10 vacancies we have, these decisions here will fill 3 of them. Well, somebody very innocently said, why do we have so many vacancies? And you can see what's happening now, right? And somebody said, oh, well, the reason for why we have so many vacancies is we've been in a bit of a budget hole for the last 2 budget cycles. Well, why have we been in a budget hole? And you see how now all of a sudden you've drifted completely off topic to something that isn't permitted within that executive session. And so one of the other recommendations that I make is everyone in the meeting, in the executive session, should be empowered and enabled to bring the board back to the topic of the executive session, meaning everyone should have the ability and be expected to speak up and say, hey, we're straying from the topic of this executive session, and bring it back. Next slide. You can't make a final decision within an executive session. And one of the questions that we often get out of this is, well, how do we know when an executive session ends? Or, you know, we reach some consensus in there, and those are all, that's all okay, right? One of the great ways to figure out that it's time to end an executive session is when I'd like to think of it as, it seems like you're repeating or going in circles. Right? If that occurs, that's a great indication. Hey, I think everybody said their piece here. It's time to go out and make a decision. Similarly, if everyone's kind of saying the same thing, maybe you're like, hey, I think that this is a great signal that we're close to our decision. So let's go out and make that decision on the record. So I think that those are great ways for you to identify when that executive session is kind of naturally nearing its end. You do have to have minutes of the executive session, but the minutes really are just going to say went into executive session under Idaho Code Section 74-205, B, to discuss the evaluation or complaint of X, John Doe or Jane Doe. But that's all it's going to say. And so they do have to be there. And again, if you have that timestamp there, that really helps with those minutes. Next slide. Next slide. Okay, so now we get down to enforcement, and I'll run through this fairly quickly. But if you don't comply with the Idaho open meeting law, it renders the action null. And what that means is not that it automatically is null. Something has to happen. Either the board has to say, look, we didn't do this right. We're going to set aside that decision, or a court would order that that decision be set aside. And so if you think, what that could mean, right? That could, for you all, right, a violation of the open meeting law could potentially result in like the setting aside of one of your public health orders. And I think that that's one of those things to always keep in the back of your mind. If we don't do it right, we create a means to challenge one of our decisions. On top of that, any member who participates in a meeting that violates these provisions could be subject up to $250 for any violation, $1,500 for a knowing, and $2,500 for subsequent or repeat violations. And that is paid for by you personally and individually as the board member, right? The board cannot pay that for you. Next slide. The Attorney General has the duty to enforce this with regard to public agencies of state government, and then the prosecuting attorneys with regard to local government. And just so you know, we are involved on this one based on the request of the Ada County prosecuting attorney. And so that's why we are involved, because the prosecuting attorney has the ability to ask our office to do these. And then any person affected can commence a civil action. And so anybody can actually challenge can make an open meeting law complaint and challenge it in court. Next slide. You can cure the violation. And so, and if I understand correctly, that is what the board has done with these previous violations that were identified. The board has taken the steps to cure them. There's a process here where it allows you to recognize it, or you receive the complaint, or if somebody just goes to court and files a complaint, you may have the ability to cure it even at that point if it's the first time that it's been brought to the board's attention. Again, that it's kind of process intensive. And I think that, you know, these are great scenarios where the board should really be working closely with its attorney to make sure that you're doing it correctly and kind of by the book. And again, you know, these are things where you really want to make sure your I's are dotted and your T's are crossed. Next slide. Next slide. And so this kind of, once you get through this, I mean, this is the cure process. Next slide. The final thing I want to bring to you, next slide, is the checklists. And so, you know, one of the things that I can't stress enough is to make sure you have a process in place to make sure that all of the little requirements of the open meeting law are complied with. And one of the things that our office has done is we've created a series of checklists. And so right here is our regular meetings one. On the next couple of slides, you'll see we've got one for special meetings, we've got one for executive sessions, we've got one for how you amend agendas and whatnot. All of those things we've kind of created to help folks through this process. And you know, at the state level, the state land board actually uses these checklists every meeting, and it's because they had an occasion where one of these smaller steps got missed, and then that put their decisions in jeopardy and required them to kind of take corrective action. And I know that as a board, it can be it can be a bit of a headache to have to go back and redo a meeting or have to admit, you know, that maybe things didn't get done correctly. And so if you have some sort of process that helps you work through this, and you go over it, and it may be the sort of thing that requires more attention for a little while, and then you get more comfortable with it, and maybe you don't have to give it quite as much attention. But I think that it's one of those things that you want to make sure that you have that process in place to ensure compliance. With that, I'm happy to answer any questions.
Madam Chair, this is Diana.
Yes, Diana, go ahead.
So, Brian, I'm just wondering in terms of what you've seen around the state, again, sort of practically speaking, in terms of how these things get done best. Do you see that agencies or governments have kind of an open meeting law chair or point person or point persons? My just sort of experience and assumption, whether it's this or other things, is that if everyone's in charge, sort of nobody's in charge. So I'm wondering if we don't need to ensure that you know, we have one or two people, and as Russ has noted, backup to the backup, who is on point and in charge of making sure all of these things are met.
Yeah, I mean, I think that's a great practice. I mean, I think that, you know, to me, a lot of times the way that it unfolds around the state is the board clerk or secretary and then the board's attorney generally kind of take the laboring oar on making sure that compliance is done. But sometimes the board chair will get involved. And I mean, I can tell you that, you know, in the context of the state land board, for example, the attorney general is the one who gets this checklist delivered to him prior to every meeting, and he pulls it out and looks at it before the meeting starts. And if a box isn't checked, well, folks have to answer questions as to either why it isn't checked or why it didn't get checked if it was done. But I think, you know, you just want to have some system of checks and balances. It's the Oscars thing, right? And losing this thing. But I think you want to have some system of checks and balances to make sure a little stuff like that doesn't get overlooked. And I think that's the the real key to making sure that you comply.
Okay, so I think as a board, we'll want to sort of talk through kind of practically who, and I'm kind of talking to you, Russ, here, who's on point, who's the backup to who's on point, who needs to see this, etc.
Hey, this is Chairman Nettleton. Ryan, thank you so much for your presentation. And is there any more discussion regarding open meeting law or questions for Brian?
Yes, Betty Ann, this is Ted Epperly. Just one quick question.
Yes, Ted, go ahead.
Thank you. Brian, very clear. Thank you for this and great insights on it as well. I'm always curious about after the meeting in terms of minutes, and I recognize here in the checkbox you just say a reasonable time period, which allows a lot of latitude. Is there a best practice for when minutes ought to be generated so that the public is aware?
So unfortunately, I've got to give you an answer only a lawyer can love, and the answer is it depends, right? And so if you're a board and you've got kind of full-time support and you're meeting fairly regularly, those minutes should be coming out very rapidly, right? It could be as short as and remember, you've got two types of minutes. You've got draft minutes that the board hasn't approved that are still a public record and available for public digest, and then you've got your official approved minutes that come with the regularity of board meetings. But I think that, if you're a board and you've got a full-time support staff and somebody that can put them together, they should be coming, and you're meeting, weekly or daily or whatever it is, those minutes should be tracking along those sort of guidelines, right? If you're a board that only meets once a quarter and you don't have any staff, then it's going to take a little bit longer to get out. And then at certain points in time, right, it may be in your board's best interest to even up that and say, look, we're in a stage right now or a phase where we're getting a lot of public scrutiny, and so we really need to make sure that these minutes are a priority in getting out there, so folks know what we're doing, and so we're also protecting what the decisions are that we're making as a board legally, if that makes sense.
Yes, thank you very much.
Betty Ann, this is Ryan. I had something I
Yes,
wanted
Brian,
to
go
say.
ahead.
So I appreciate it, Brian. The training is really good, and I appreciate that. And I would just like to say that this is a learning curve for everyone. I think because there's no being someone who's gotten into politics, for lack of a better term, randomly, was not expecting this, and coming from being over in politics for just a little over a year now. There's a steep learning curve, and there isn't. One thing that I was surprised about is that when you get into politics, nobody sits down and says, hey, you need to be taught how to do these things. So here's a list of things you need to know and need to learn. Those things were never, for me at least, were never expressed. I went into politics, I got into county commissioner's position, and I've been learning as I've been going. And so anytime that training comes up like this, it's great. But I think more for the public's interest, it's an understanding on their part to realize that there are folks of us out there like myself who are not career politicians that I know as much about politics going into all of this as some of the lay people that are watching the meeting. And so that's a big understanding that violations aren't necessarily done on purpose, which I think obviously the code covers that and that's why the opportunity is there to make the correction and make the changes. But we don't, it's not, the public sometimes I think thinks that we do things on purpose to violate the open meeting law and try to get away with it. And I would just like to say that that's not the case. It's more often than not an accident, and it's something that was done without really realizing what was being done. And so we want to be able to correct that, and I don't think anybody's trying to be secretive and do things behind anyone's back. It's just a matter of understanding and learning and not knowing necessarily, not always knowing or understanding what the code or the law is behind it. And so I would just, I just wanted to say that because I think that there's a little bit of a disconnect there where there are folks out there that listen to our meetings, see our meetings, and see the things that we do. And when there is a violation made, sometimes the automatic thought is that violation was made on purpose, and that it was done maliciously, and that's just not the case. A lot of times we didn't know, and the person watching did happen to know, and so there's a disconnect there sometimes. And so I personally appreciate the training because I take as much of it as I can, just so that I can stay in compliance and stay in an understanding. So I appreciate it, Brian. Thank you.
Sure thing. And I think that, I mean, to me, I hope that everyone knows that the goal of the open meeting law is compliance. And our office approaches the open meeting law with the goal of compliance. And so I hope that you have seen and experienced the fact that our office, our preference is for compliance over kind of hammering a board for exactly the reasons that you identified, right? Once you're sworn into office, you're presumed to know all of the law that you're under and operating with and enforcing and all of those other sorts of things. And it's not, I know that kids are going back to college now, and a lot of them get, 2 or 3 days of orientation to college. There's no real, welcome to government session, and maybe there should be. But I hope that you understand the goal of this law is compliance, and the way that we incentivize folks to comply is through efforts like this to say, hey, here's where you may have overlooked something, here's how you can not overlook it in the future, and here's a best practice for your entity as you move forward.
Betty Ann, this is Representative Blanksma.
Yes, Megan, go ahead.
I just had a question for Mr. Kane. Since this is the second time I've sat through training on open meeting laws, we have to do it annually for the legislature. Does that mean I get a pass in January?
I don't know. It almost sounds like you're volunteering to conduct the training.
I definitely feel fairly well versed.
Excellent.
And I do have one question, though, also, Brian, if I can really quickly.
Sure.
When you talk about liability if you're on the meeting, I was not on that illegal meeting. I'm not guilty by association on that, am I?
So no, I mean, it's, and if you look at the enforcement provision, it's members in attendance. And I will note that there are kind of some sticky wickets within that, right? If you, for example, think that your board is going into an executive session for a reason that they shouldn't be going into executive session, do you sit out the executive session in protest and say, I'm not going to participate in an illegal meeting? Or do you say, I oppose this executive session, I'm voting against it, but I'm also going in there to keep an eye on you all to make sure you don't go and do bad things that I think is what you're going in there to do anyway. And so there's a little bit of a sticky wicket, but I think that anytime you're put in a situation where you don't think the board should be meeting on something, the very best thing you can do, aside from just not attending, is to note it in the record, right? And say, I'm voting against this, for example, this executive session because it was not properly noticed, and I want that recorded in the minutes. And that's probably, as individual board members, one of the best ways to kind of both protect yourself, but then also to kind of check and balance the ability of the board to comply.
Thank you.
Any further questions for
Yep.
Brian?
Yes, Madam Chair, this is Commissioner Hasbrook. I have one more question for Brian.
Yes, go ahead, El.
Brian, I've been in quite a different boards throughout my life, and I know there are some board members that are actively pursuing illegal kind of meetings. Is there a way for someone, or you could call someone to report a board member that keeps doing that? I mean, how do you handle that situation? They want to talk during the lunch breaks. They want to have behind doors secret little meetings, and it's very frustrating because you can't, they're voted in, you can't fire them. What do you do? How do you report somebody like that?
So the best advice I can offer you at this point is report that person to your entity's attorney. And so if you've got somebody who just doesn't want to comply with it, sometimes the attorney is one of the better ways to deliver that message.
Okay.
Because, the attorney is responsible for defending all your board decisions. And if all of a sudden there's some way where the attorney can't defend it, number one, they need to know that. And then number two, right, you may be putting the board in a position where it's going to be, monetarily liable for a significant sum.
But as a board member, I would assume I would want to, in the minutes, that I disagreed with whatever decision they made because they didn't make it legally. I would want that in the minutes to protect myself.
You could, yeah, you could absolutely do that. Before you get to that point, though, I would hope that you would talk to your board or entity's attorney.
Okay, thank you.
Sure.
Any further questions for Brian? Well, Brian, hearing none, I certainly express the board's appreciation for your education today. I think it's probably helped all of us. And I guess if we have any further questions, we can, our people can contact your office, correct?
Sure, and you can also contact your attorney as well.
Right, okay. Well, thank you so much.
Sure thing, thank you.
Okay, proceeding on with our agenda. Next, we will be going into executive session under Idaho Code 74-206F to communicate with legal counsel for the public agency to discuss legal ramifications of and legal options for pending litigation or controversies not yet being litigated but imminently likely to be litigated. Do I have a motion to go into executive session from a board member, please?
Madam Chair, this is El. I'll make the motion that we go into an executive session per Idaho Code 74-206-1F.
Thank you, El. Do I hear a second for that?
Madam Chair, this is Commissioner Laciando. I'll second.
Thank you, Diana. Okay, we will take a roll call vote, starting with Boise County.
Commissioner Sturm, aye.
Valley County.
Commissioner Hasbrook, aye.
Ada County.
Ted Epperly, aye.
Ted, go ahead, Ted.
Yeah, Ted Epperly, aye.
Diana.
Commissioner Laciando, aye.
Jane Young, are you there? Can't hear you.
It looks like her
Now,
internet's dropping on and off.
Okay.
Jane Young.
All right, we will. I'm sorry, was that you, Jane?
Yes, it is, Jane. Sorry.
Oh, and your vote to go into executive session is?
Aye.
Okay, thank you. Elmore County.
Representative Blanksma, aye.
Okay, thank you. Motion to proceed into executive session has passed. And Dustin, you will take us into
We're out. Betty Ann, I'm going to step away and invite our guests back to the conference room. It'll just be a second. Betty Ann, I'm going to step away and invite our guests back to the conference room. It'll just.
Okay. Thank you, Russ. Okay, well, we will wait just a moment while those folks come back into the conference room. Is Mike Kane still on? I think he's off.
He just walked out of the room.
Yeah, he's still on, Betty Ann, but not physically sitting at his computer.
Okay. I forgot to thank him for his help today.
Here he comes back. Betty Ann, Mike's back now.
Mike, are you on now, Mike?
Yes.
Oh, okay. Well, this is Betty Ann, and I'm sorry. I apologize. I did not express our gratitude as a board for your help today, so much appreciated.
Thank you.
Betty Ann, this is Russ. We're ready to go on our end.
Okay, fine. Thank you, Russ. Okay, proceeding with our agenda, we will go to the introduction of our new Human Resource Manager, Gary Foote, and I will turn it over to you, Russ.
Okay, thank you, Madam Chair. Let's make sure. Gary, are you on?
Yes, I am.
Okay, great. So by way of introduction, Gary has been with us for, I think, a little over a month. He has an extensive career, military career, over 20 years in the United States Air Force. And then most recently, he was a Human Resources Specialist Senior at the Department of Administration before joining us. So I wanted to give Gary a chance to introduce himself, share a little bit about his background, and then he will be part of the discussion we're going to have next with regarding state law regarding employment decisions. And I think it's been really helpful that he has that experience with another state agency for quite a period of time. So he's very familiar with all the state rules and state laws. And Mike will be doing the presentation. I'll have some comments to make when he's done, and then maybe you may have some questions for Gary as well. So Gary, do you want to introduce yourself more than what I just shared?
Absolutely. Thank you, Madam Chair, members of the board. I appreciate the opportunity to speak with you today. Yeah, so just like Russ had said, I have just over 20 years in the Air Force. 13 of those I spent in human resources. I retired from the Air Force in 2013, and then shortly after retiring, within just a couple of weeks, I got hired by the Department of Administration, and I spent almost 7 years with the Department of Administration. I'm extremely happy to be here. This is a great team that we have. I am challenged on a daily basis, and I really value the culture that the organization has. And I guess with that, if you have any questions for me, I can certainly answer them or continue going on. I don't want to do like I did yesterday and take an hour and a half of a meeting.
Okay, thank you,
Betty Ann.
Any questions for Gary?
Betty Ann, this is Megan.
Yes, Megan, go ahead.
God bless you, Gary, for not wanting to take extra time on the meeting, and welcome.
Thank you.
Yes, I would echo that on behalf of the board. We're glad to have you aboard, Gary. And did you have anything more to say about yourself? Or if not, we will proceed with the discussion regarding the status of the state law regarding employment decisions.
Yes, thank you for that opportunity.
Uh-huh.
So, Russ, did you want to do an introduction while doing this, or how do you want to do this? Yeah.
Sure. Madam Chair, this is Russ.
Yes, Russ, go ahead.
So I just, by way of introduction, as Mike will go through the specific sections of Idaho law around the board's authority and my authority and how we're structured within government in the state of Idaho. Historically, boards of health appointed directors. They also set their rate of pay. That was determined by the appointing authority. The director would also bring forward a proposal for setting the rate of pay for staff of the agency, and that is typically done through the budget setting process, where the Board of Health has presented a budget to include salary increases for staff. We've always done those on a merit basis, and things have changed in recent years where the governor's office essentially has been managing both of those. So it's more recently, I'd say the last 2 to 3 years, there's been basically blocking of the proposals that have been presented to the board, and it's not allowed us to move forward with salary increases for staff. The other issue is determining the positions for the agency. We've had some significant challenges working with the State Department of Human Resources and getting positions established, getting positions approved or modified. Some of those delays have been upwards of several months. We have attempted to establish a community health worker position, which is a concept that was born out of the statewide healthcare innovation plan grant. That, for example, we have been working on for over a year. And as of this point, with full interest and cooperation with the other public health districts, we still have not had that position established. So I'll stop there, but it's more a matter of I wanted to make sure you're familiar with Idaho law, which Mike will review with you. And then we're going to have to talk about decisions on moving forward. If this is something that you're interested in getting resolved, which I hope you are, we'll have to talk with Mike about a plan forward. So thank you.
So with that, do you want to bring up the first series of slides, Russ?
Sure.
As he's doing that, I can tell you that I've been working with your district for about 15 years, and about a decade ago, we visited with several other trustees from health districts and directors, and there was no will at that time to kind of resolve the issues that you're about ready to see. The short version of which is that the state law essentially has you marching in two different directions at the same time regarding employment decisions. And in light of the fact that there's been a lot of discussion about the next session about looking at health districts in general for a whole number of reasons, it occurred to us that this is probably a pretty good time to begin talking about what the law currently is. So if you can go to the next slide, Russ. This just kind of tells you the code sections that we're going to be speaking about. You'll see that we're talking not only about your own code sections, but also code sections as far as the Division of Human Resources. They're also all in play. Go ahead. Go ahead. Thank you. So,
Madam Chair. Madam Chair, this is Representative Blanksma. Yeah, I just would like to remind Mr. Kane that he needs to be telling us what page he's on for those of us that have printed materials and don't have access to the video.
All right, thank you, and I apologize for that. So I believe we're on the third page. The very top says 39401 legislative intent. And this is the current statute that begins your health district chapter. And as you can see, what I've got highlighted here is that the legislative intent is that health districts are not a single department of the state government, nor any part of the 20 departments of state government authorized by Section 20 of the Article 4 of the Constitution or other departments. So right from the bat, you can see it's the legislative intent when they passed this law in 1971 that you are not an entity of the state. Go to the next page, please. So if I'm right, this is page 4. This is a continuation of the same statute. And you'll see I've got highlighted here that it's the legislative intent that health districts operate and be recognized not as state agency or departments, but as governmental entities whose creation has been authorized by the state, much in the manner of other single purpose districts. So far, what they seemingly are telling you is that you are not an entity of the state. You are not part of the state government. Continuing down, you'll see again, it says pursuant to this intent and because health districts are not state departments or agencies, health districts are exempt from the required participation in the services of the purchasing agent or employee liability coverage as rendered by the Department of Administration. So far, so good. It seems like you are not a state entity. Can you go to the next slide, please? I think we are now on page 5, if I'm right. However, you'll see we're still on the very first statute. It says it is legislative intent to affirm the provisions of section 39-413 Idaho Code requiring compliance with the state merit system. We'll talk about 39-413 in a minute, but you see here that they begin to say that they believe that you should be required to comply with the state merit system, even though they're also telling you that you're not a state entity. And then down at the bottom of this slide, you'll see that it says this section merely affirms that health districts created under this chapter are not state agencies. So already in the first chapter, first section of the chapter, you're being told two different things. One, you're not a state entity, but two, you're required to comply with the state merit system. We go to the next slide, please. And this is page 6. This is the chapter that speaks to the establishment of the Board of Health, 39-410. And as you see, it establishes public health districts and sets up a board, that would be you, and it tells you that you are vested with the authority, control, and supervision of the district health department. It puts you in charge of steering the ship as to district health. Go to the next slide. This is page 6, 39-413. This is the section that speaks about the health district director, Russ, his powers and duties. And it says here, a district health director shall be appointed by the district board. I'm going to stop there. What I've done, you may recall there was some controversy a year or so ago about if you are the persons that are going to be appointing the district director, then is it not you that's supposed to set that person's salary? You may remember there was some discussion about that with the executive branch. I went to the Idaho Supreme Court case law and found a case almost 100 years ago that pretty clearly says the power of making the appointment being unquestioned, and it's certainly your case, the right to fix the salary of such officer by the body making the appointment is incidental. It would be illogical to hold that the right to make the appointment did not carry with it the authority to provide for compensation. So as far as I'm concerned, for approximately 100 years, the law has been that if you appoint someone, you get to set their salary. Please go to the next slide. We're on page 7. I'm now excerpting from the very same statute, which is the board powers. And in that statute, section 4 says, and we're talking about the district director here, with the approval of the district board, A, to prescribe the positions and the qualifications of all personnel under the health district director on a nonpartisan merit basis in accordance with the objective standards approved by the district board. So what 4A looks like is a statute that tells you that you set the standards for qualifications and positions within the district. But look at the next, look at 4B. It then says, fix the rate of pay and appoint, promote, demote, or separate such employees, and to perform such other personnel actions as are needed from time to time in conformance with the requirements of Chapter 53, Title 67. What that is the Human Resources and Merit System series of statutes. So on the one hand, you're being told that you're in charge of setting objective standards for personnel, but at the same time being told that you have to comply, you have to act in conformance with chapter dealing with human resources in the merit system. This is the central issue that needs to get determined, because what it does essentially is it tells you, as I've already said, it tells you to march in two different directions at the same time. Are you in charge of these decisions, or is the state executive in charge? Please go to the next slide. So what I've then laid out before you is 39-414, powers and duties of the district board. And it tells you the district board of health shall have and may exercise the following powers. And you'll see I jumped ahead to section 12, which deals with enter into leases or of real or personal property or other transactions with the health facilities authority. It's a lending institution that allows you to build your buildings. Go to the next page, please, to carry on. About 12 years ago, the state health facilities authority was not lending the districts money to build buildings because it wasn't clear enough that you were an independent body and not a subdivision of the state. So at that time, we, meaning several districts and myself, put together a statute which was passed, I believe, unanimously by the legislature. And you'll see it's in blue here. For the purposes of this chapter, a public health district is not a subdivision of the state and shall be considered an independent body, corporate and politic, pursuant to the Constitution of the state. We got that in specifically so that it was clear to everyone that you were not an entity that was a part of state government. Below that, I have the actual excerpt from the constitutional article in question that we essentially incorporated into the statute to make it clear that you were not a state entity. Go to the next slide, please. So what I've done here is I've given you a series of statutes. This begins with 675301. And I'm afraid I've lost count of the pages, but you can see right on top 675301. Establishment of Division of Human Resources. That's the chapter that, frankly, is in conflict with the health district statutes, beginning with establishment of Division of Human Resources and declaration of policy. And you'll see that I've highlighted in blue that this law is for classified Idaho employees. The purpose of said personnel system is to provide a means whereby classified employees of the state of Idaho shall be examined, selected, obtained,
Madam Chair, this is Representative Blanksma.
Yes, Megan, go ahead.
Just a quick question. Have we ever asked for an AG opinion on the conflict between the two statutes?
We have not. That's one of the discussion points for today.
Madam Chair, this is Diana.
Yes, Diana, go ahead.
I'm going to have to excuse myself to hop on to another call. I hope to be able to come back on this one, but I'm going to have to note that for the record.
Okay, thank you. Go ahead, Mike.
Thank you. If you go to the next slide, please, Russ. All right, 675303, application to state employees. All departments of the state of Idaho and all employees in such departments shall be classified employees who are subject to this chapter. So by definition, that is not you. You are not a department of the state, says the legislature. Please go to the next slide. This is the state employee compensation philosophy, 675309, capital A. And you'll see that it is declared the intent of the legislature and the goal of a total compensation system for state employees shall be to fund a competitive employee compensation benefit package. Again, it does not appear to be you and your staff. Go to the next slide, please, Russ. This is again from the Human Resources Statute 675309, capital B. You'll see that the Idaho Compensation Plan, Section 2, shall be the responsibility of each department director to prepare a department salary and administration plan, a corresponding budget plan that supports the core mission of the department. So again, you're being told you're not a department, that Russ is not a department director, but yet, apparently, you're expected to comply with the statute. Go to the next slide, please. That's it. So, as you can see, it's a very murky issue. Who controls your hiring decisions? Who controls your salary decisions? Who controls the issue of raises? And the reality is you can make a principled argument either way as to who is control those decisions. And questions have been raised now to the point where it's come to a head. And Russ and I are looking for guidance from you as to where you want to go now with this, as the executive branch has been involved much more heavily than they have in the past in this kind of decision making. So Russ, did you want to take over from here and give specific examples or talk about what you've been talking about with your other directors?
Sure, Madam Chair. Russ?
Yes, Russ, go ahead.
Yeah, as Mike just had described, this issue really has been the last probably 5 years or less is where it became more restrictive, more challenging as far as issues like establishing rates of pay for staff, for example, equity adjustments, merit adjustments, all have to go through the state to have those processed. And I will tell you, just strictly from the data, we're in a very competitive employment market here in the Treasure Valley, and it's becoming more competitive. And we're, to a great extent, half of our business is in healthcare. So by having restrictions placed on the agency outside of what has been approved or developed by me as a proposal and our leadership team presented and approved by the board and approved by the county commissioners who set our budget every year, it's left us with high staff turnover rates, for example. And quite frankly, it makes us inefficient. When we have a person leave the agency and it takes us months in some instances just to get that position announced, or in the case of the community health worker, which would be of quite great value right now, working with the community around COVID issues, we can't hire for that position because we've not been allowed to establish that position, in spite of the fact that all 7 public health districts have agreed that we would like to have that position available for the public health districts to hire. So, as Mike said, it's becoming more of an issue. It has not been an issue forever. The first 10 years or so that I've worked here, we've always been able to come up with reasonable plans and get those approved by the state. I can't say on the hiring side that it's always been smooth, but it's gotten, I would say, considerably, it's declined considerably as far as the opportunities we have to manage our staff, personnel, salary decisions, and otherwise. So I will stop there. I do hope the board will work together on a solution and work with Mike on some ideas how we might try to advance this to allow us to become more efficient, more effective, and retain our high-performing staff.
So the options are many for your consideration. One is to just let things keep going the way they're going and not get the question answered and essentially, for all intents and purposes, agree that the state is in fact in charge of your district when it comes to, and all districts, when it comes to personnel issues, salary issues, raises, replacing employees, that sort of thing. And let it go on until some other issue creates enough of an issue to potentially move for change. Another option is, as Representative Blanksman said, is to see what the AG thinks about all of this. And of course, the AG is, ironically, the AG does not represent non-state entities, so it would have to be either a legislator or a state official, state agent that would have to ask for the opinion. And then, of course, you would have an opinion, and then you would have to determine whether or not you're prepared to accept it, and if not, then what then? Another option would be to try to do something legislatively, which would obviously involve all of the health districts, and of course could be quite a project. Another option is, and I'm not recommending it, is to seek a declaratory judgment action from the courts. That would be a very time-consuming, very expensive process, and be careful what you ask for because you might get it. So none of these options are great, but the question is kind of what is the will of the board? What would you like to see happen?
Madam Chair, this is Eld.
Yes, Ellen, go ahead.
You know, when I read this, when you guys sent it out, I thought, well, this really cinches the decision for me that we're a separate entity. We can pretty much do what we want. I like Megan's idea of approaching the attorney generals to see if they will give us a confirmed, solid decision on what side of the fence we're on here. If that doesn't work, then I'm assuming that we would probably take the thing on up the ladder to the court system. But before we go that far, I would like to have that opportunity for the attorney general to at least weigh in on it. He may say, no, I can't do anything. This is none of my business, and whatever excuse he comes up with. But we have got to get this answered and get this done because we've been dealing with this for too damn long.
Any further input?
This is Ted Epperly, Betty Ann.
Yes, Ted, go ahead.
Yeah, I definitely, at the end of the day, we want the public health departments to be able to control their own destiny. I think it's pretty clear, and Mike, thank you for pointing out all the statutes related to this and the nearly 100-year-old law that should make the public health departments their own entities in regards to controlling operational issues internal to them for efficiency, effectiveness, hiring, setting salaries in ways that keep them competitive. I think at the end of the day, we all want that. I would totally agree. We need to do this in a thoughtful way. I think what Megan has offered in terms of the AG opinion and El just commented on, I would agree totally with. Let's start there. Perhaps this will all be resolved with them, which would make it clear to move forward. If it's not, then as Mike says, then we've got another set of options to take a look at. I'm personally in favor of pursuing any option that will help get the public health departments in a better place long term. Because if we don't, we'll hamstring them in a competitive environment in which we need a very functional public health department. The pandemic has really proven the value and worth of having a very effective public health department. So those are my comments at this point.
Madam Chairwoman, this is Representative Blanksma.
Yes, Megan, go ahead.
Point of clarification, I didn't offer anything. I asked a question.
Okay, thank you, Megan.
It might be nice, Madam Chair, it might be nice if Representative Blanksma would take the next step, though. If indeed, as Mr. Kane has pointed out, we're not a state agency, then this will need to come to the Attorney General's awareness through an elected representative.
Well, this is Ann. As for my own input on this matter, it's just been going on for so long. We have and are in jeopardy of losing qualified staff, and I just would like to go ahead with the most expedient legal situation to get this corrected so that we're not losing our qualified people, and for those positions we have to fill, that we can fill those positions with people that have some a future in our agency, rather than sitting on the fence like we are now.
Madam Chair, this is Al.
Yes, Al, go ahead.
Mike, can I ask you a question? Do the other health districts, did they get all this information from you as well? My reason for that question is because maybe this is something that the executive council or the trustees could get together and talk about. Okay, here's plan A, that we'll try and find someone to present it to the Attorney General's office. If we can't get that done, then do we want to start saving funds and look at this in a district court situation? Or are we the only ones that know about this yet?
Madam Chairman, Al, this issue is not a secret, but you're the first people to actually see this slideshow. The plan is to involve the other health districts, is it not, Russ? Before we get much further, we needed to get some sense of where you want it to go before we started down all the other health districts, is it not, Russ?
Madam Chair, this is Russ.
Yes, Russ, go ahead.
Yeah, as Mike pointed out, this is not new to any of the health districts. We all, I think, share the same concerns. I don't know that there's a shared agreement on an appropriate path forward, but this really was the start of the conversation. And I guess I would offer another alternative to, if the AG's opinion wasn't something we were able to pursue. I just put this out there, is to sit down, have the board sit down with the governor and talk through this, or the governor and his staff, and try to come to some resolution before we pursue some of these other alternative options that Mike had described.
Further thoughts?
Madam Chair, this is Elt again.
Yes, El.
Russ, I'm wondering if we could get maybe some of your staff or even Brian to put all this in a PDF format, just this stuff that he's presented to us, so that we can use that to kind of spread around to some of the other folks in the district or in their districts, and to get the ball rolling. I know there's going to be some other trustees that are very interested in this, and see what that feeling is with the other 6 districts. And we can do that through an executive council or however you want to do it, but we need some way to get what Mike has put together out to the right folks so they can have a chance to review it and look at it and make their own decision.
Madam Chair, this is Russ.
Yes, Russ, go ahead.
Yeah, I'd be glad to share that with Mike's permission with the other districts. He has always represented Public Health Districts 3 and 4, and since the pandemic started, he now represents 4 public health districts, including Districts 2 and District 7.
Oh, I can certainly get it out to them. There's no issue there. There's nothing. I'm just citing statutes.
Madam Chair, this is Jane.
Yes, Jane, go ahead.
I just had 2 questions or comments. One, I really appreciate seeing it all put together like you did, Mike, because it's been something that we've struggled with for so long. So to see it all sequentially has been very helpful. The other part is it gets in the way of us being able to accomplish any of our goals that we've set as a public health district. So if there's a way to make sure that that's at the outset, that would be helpful too. Thank you.
So,
any further? Who's speaking?
So trying to understand what I'm hearing here, do you want us to approach the other directors and trustees before we take any further steps? What I'm hearing?
What's the flavor of the board there? Or Russ, weigh in, please.
Well, Betty Ann, this is Ted. I really defer to Elt's opinion on that. Elt is our trustee to the group. Is your sense that it would be wise to do that just for their awareness, hear their thoughts, or Elt knowing kind of how it is to deal with the other districts? Is it wise that we take the first step, and perhaps by leading, they'll follow?
Madam Chair, this is Elt.
Yes, El, go ahead.
I think our argument is stronger if all 7 districts come at it from the same side. Whether Mike can represent us or if Megan can do it for us, I'm not sure how that process works, but it has a lot more authority when all 7 districts are signed on to this instead of just 1. That's my thinking. And if we can get the PDF to them to show them the evidence that Mike has brought up now, so they have a chance to kind of look at it, peruse it, and talk about it. And then our next executive council meeting, we can agenda it and get it on an agenda and talk about it. And I can get their feeling, but I have a sneaky feeling that probably at least 5, maybe 6 of the districts are very supportive of this going forward, and maybe even the 7th one, I don't know yet. But to me, it just gives us a stronger position when all 7 districts are on the same page.
That makes sense. Russ, just a question for you, if I can, Betty Ann.
Yes, go ahead, Ted.
Since this has been going on a long time, Russ, I would assume there's no time urgency. In other words, we have, we want to get it resolved sooner versus later, of course, but anything pending that makes this really urgent to act on other than the process that Elt's outlining, getting it out to everybody, talking it through, getting feedback, going through kind of a deliberative process.
Madam Chair?
Yes, Russ, go ahead.
Yeah, I think you're exactly right, Dr. Epperly. It's been going on for a while. No question in my mind, we need to come to some type of resolution. Probably the most pressing issue at this point is hiring staff, which we've been doing under a temporary basis, so we don't have all the hoops, so to speak, to jump through to bring on staff such as disease investigators and contact tracers and additional public relations staff. But I think the sense of urgency on that end is it's really difficult to hire and retain temporary staff, non-benefited, versus bringing individuals on even under a limited service agreement where they would have a commitment to employment for a period of time. We know this pandemic's not going to end anytime soon. The public health district's role will continue, except it'll ramp up even more once a vaccine becomes available, hopefully later this fall or winter or next spring. So that's probably the one area where I can see a little bit of a pressure point is the inefficiency of announcing and getting somebody to review the position applications, and for us to get the referral list and to do the hiring. It's like I said, it's a very slow process. So that's probably my biggest concern area right now.
Madam Chair, this is Jane.
Yes, Jane, go ahead.
So if we talk with all the districts and we all approached it as one, is it better to go to the governor and have a conversation first and then find out how to carry it out with the AG, or which is the best next step after that?
Madam Chair, this is El.
Yes, El.
You know, I don't really
Go
know
ahead.
the answer to that one, Jane. I was hoping maybe Megan would know that answer. What's the best way to approach it? I just think that.
Madam Chair.
Go ahead.
Yes, Megan.
Yeah, actually, I do know the answer, and he supports the current interpretation that's been made by Susan Buxton.
What does that mean, Megan?
I'm sorry, what's that?
This is Jane. What does that mean? He supports what?
He supports the current interpretation by the Department of Administration and Susan Buxton, which is what we're currently operating under.
Oh.
Just a point of clarification, Megan, this is Betty Ann. When you say he, you do mean the governor. Correct?
I haven't spoken to, Madam Chair, I haven't spoken to him directly, but I have spoken with staff. I spoke with staff during regular session this year, and yes, that was my understanding, that their interpretation was not going to change.
Oh, okay.
Madam Chair, this is El.
Yes, El, go ahead.
So Megan, I got a question for you. Can you go to the Attorney General's office and ask them for, or is that going to make the wrong people mad, or how does that process work?
Madam Chair, any legislator can ask an opinion of the Attorney General.
So would you be willing to do that for us?
I would, Madam Chair, I would have to see what Mike Kane writes up, that what the request would be of the Attorney General before I would agree to make that request.
I can do that.
Okay, thank you.
So Madam Chair, this is El again. Is this an action item?
Yes, El, go ahead.
Is this an action item on the agenda?
No,
Can I make a
No.
motion?
no.
No, I didn't think so.
actually,
point
Madam Chairwoman,
yes, go ahead, Megan.
you actually did put it under action, point of information, you did put it under action items on the agenda. It's listed as discussion regarding status of state law regarding employment decisions, but it is under action items.
Madam Chair, this is Elt again.
Yes, El, go ahead.
If Mike's good with this being an action item, which I'm not sure he is.
Well, I thought it was supposed to be about a discussion, but Representative Blanks was correct. Everything.
And I would like to go ahead and make a motion that we as a board pursue, or ask Mike if he can come up with some kind of a short summary letter, a one-page letter, why we're asking for this, and put it all together with our PDF on the code as he has presented it, and then get it to us and we can look at it, and if we like it, then we can decide then how to proceed.
Okay, thank you, El. Is there a second to that motion?
Chair, this is Jane Young. Yes.
I'm having a real problem understanding you, Jane. Did you second that?
Yes.
Okay, thank you. Thank you. Any further discussion regarding the motion? Hearing none, I'll call for a vote by county. Boise County?
Commissioner Sturm, aye.
Valley County?
Commissioner Hasbrook, aye.
Ada County?
Jane Young, aye.
Ted Epperly, aye.
And I think Commissioner Lacchiondo's on another call. Elmore County?
Madam Chair, I just want to be clear, my vote is yes to allow Mike to write the letter, but I am not agreeing to anything as far as where that letter goes.
That's correct.
Okay, so noted, Megan. Thank you. Okay, the motion does pass, and so we will proceed on with that. Question, when is your next trustee meeting?
We actually had one here last week that was a total disaster. It all ended up being about the mask mandates, and we had quite a few trustees that were for it and one or two that were against it, and it went on for about an hour. Finally, I got kind of tired of hearing the same point over and over and over, so we adjourned the meeting. They're hoping to have one, depending on what comes out of this special legislation. They were concerned about some health department introductions to take our authority away and all that stuff. Well, the governor took that off the plate, so that's not going to happen. So I'm guessing it's going to be probably later on in the year, maybe November, December, before we get together again. But who knows?
Okay. Thank you. Okay, thank you, folks. And Mike, thank you for doing that.
Thank you, and I believe that completes my business today with the board. So unless there's something else, I'll sign out. And thank you for your input.
Any further questions for Mike?
No.
Well, I'm sorry. Yeah.
I think there was a no.
I thought Oh, okay. All right. Okay. Thanks again, Mike.
Thank you.
I'm sure we'll be talking to you soon. Thank you.
Thank you.
Okay. Proceeding on for our fiscal year 2020 year-end financial report. Bonnie, are you there?
Yes, I am. Can you hear me?
Yes, we can. Welcome.
Great. Thank you. Good morning. Thank you. In the interest of time, I will try to go over the fiscal reports today fairly quickly while still covering all the relative points. So if you want more clarification on anything or have any questions, I will be happy to address those. So starting with the fiscal year 20 year-end budget to actual report, and Dustin has that up on the screen. We ended the fiscal year in a very comfortable financial position. Our total funding was very close to budget at 99%. Total expenditures were under budget a little bit at 95%. Our undesignated cash balance at the end of the fiscal year was about $674,000. However, we do have contractual restrictions on at least part of that balance, and I will discuss that a little bit later. Looking at revenues and reserve funding on this report, you can see fees came out 12% in total over budget. Service fees in both community and environmental health and in family and clinic services were over budget, so that's great to see. Total contracts were right at 100%. There was a little bit of variance between the two divisions, but they did come out right at budgeted levels. Other revenue in total was under budget. Support services was high with proceeds from the sale of surplus property and vehicles, and also the receipt of an Idaho Power incentive for energy efficiency changes we made with the Boise office remodel. Community and environmental health was also high with unbudgeted WICHC partner contributions. But family and clinic services was low. The reason for that is, of course, we are cash basis. I had included $170,400 in our budget for anticipated home visitation funds for fiscal year 21. In prior years, Health and Welfare has made that payment at the end of the prior fiscal year. So I expected the 21 fees in fiscal year 20, and they didn't make that payment this year. But those have been received in the current fiscal year. County contributions, state appropriation are right on. Interest revenue is just about $3,400 high. We ended the fiscal year with reserve fund draw of $763,000 for the Boise office remodel. And you can see that is under the budgeted level. We did have some savings on the project, but also there was a final payment for the Boise office remodel of about $147,000 that we did not make until the current fiscal year. We were just waiting for them to wrap up some of the final punch list items, and we held on to that payment until then. Looking at expenditures, personnel is at 99%, so very close to budget. I did want to point out, though, that 1% savings represents about $120,000. You can see there was a lot of variation in personnel between the divisions. A lot of staff time was diverted from their usual programs to the EPI and public health preparedness programs in community and environmental health due to the COVID response. Looking at operating, we are under budget at 86%, particularly low in administration and support services. In administration, we had a marketing project, which was about $40,000 that was delayed due to COVID response. And in support services, we had, I believe it was $146,000 budgeted for to complete the rest of the building in Boise that was not touched by the remodel with new carpet, paint, and furniture. And we postponed that while we were waiting to resolve some issues we were having with the new carpet. Looking at capital outlay, that is also under budget. And again, that is due to delaying the final payment on the Boise office remodel. Dustin, if you can go to the next page. This is just another presentation of information on the fees and contracts revenue and also personnel operating and capital outlay. What I did want to mention on this page, if you look at fees, we're seeing a really positive trend in both community and environmental health, and now in family and clinic services. Community and environmental health, of course, our total fees have gone up consistently from fiscal year 18 to 19 and 20. But also in fiscal year 20, we saw our family and clinic services fees go up. So that's great to see. Dustin, if you can go to page 3. Okay, this is our cash balance statement as of the end of June and the end of the fiscal year. You can see our total cash balance at month end was $2,667,546. When we reduce that by the board approved reserve fund designations, we end up with an undesignated cash balance of about $674,000. Again, I wanted to point out that of that total, $146,000 is committed to prepaid contracts or other projects.
Bonnie, I have a question.
You bet.
Did we talk about, and maybe I can't remember it's for you guys or the county, but didn't we talk about bumping up the personnel reserve fund like 3 times the 87,000?
We did that in, I believe it was February, when we did the budget revision. At that time, the board approved new reserve fund designations for last fiscal year.
That's right.
So that was increased. And the 87,000, because we just started that fund, that designation about 3 years ago. So that's like 3/11ths of a total payroll.
Right.
After this agenda item, I will be discussing reserve and carryover designation proposal for the current fiscal year. And I'll be proposing that that be increased again for the 4th year.
Okay, thank you.
Okay, any other questions on this?
Well, Bonnie, before you move on to later items here, during the pandemic, did we not receive, as a health department, a fair number of federal grants?
We did. And of course, the activity really heated up, of course, in March. You look at, well, contract revenues for the fiscal year. You can see contract revenues in community and environmental health was over budget by 4%. I would attribute that to the COVID funding we received at the end of the fiscal year. But again, all of our contracts are reimbursement based. So we had like at least a month expenditures that we didn't receive for until the prior month or the next fiscal year.
So just to understand then, the revenues received from federal grants were just incorporated into the revenue streams of the existing line items?
Yes.
Okay,
That is
thank you.
correct.
Okay, thank you.
Any questions for Bonnie? Okay, hearing none, we will proceed on the cash carryover designations. Bonnie, go ahead.
Okay, so Dustin, if you could pull up the fiscal year 2021 carryover and reserve fund proposal, please. Perfect, thank you. Just a quick review. Our agency's reserve fund policy states that annually, after the close of the prior fiscal year, the Board of Health will assess our cash fund balance and make fund designations for the current fiscal year. Our policy lists 4 categories for those designations. Special projects or carryover projects as determined appropriate. The personnel reserve, which is to save funds for the occasional 27th pay period that occurs about every 11 fiscal years. We have an operational reserve, primarily for cash flow needs and emergencies, and the capital reserve fund for major facility related costs and capital planning. The top of this page shows the calculation of our available cash. You can see the total cash balance of $2,667,546 is reduced by 1,060, which is our clinic startup funds. Essentially, every office maintains a few funds just to make change or whatever for those clients paying cash. And we also have an additional 146,000 in restricted or committed obligations due to prepayment of contracts or other projects. That leaves an available cash balance of $2,520,326. So the bottom, under the line in the middle of the page, that includes our proposals for this year's designations. Starting with the proposed special projects or carryover designations, we have a total of 298,100 in projects. The first one being the final payment of our Boise office remodel of 146,900. And again, that was budgeted last fiscal year, but it won't be made until the current year. Also, the completion of the new carpet, paint, and furniture in Boise office in the unremodeled sections, that also was carried, or I'd like to carry that forward. That's 146,200. And the last project, I request $5,000 to revise the lighting in the FCS reception area. What we have found, everything was done according to the plans, but especially in that tree area, it's just a little dark. Then moving on to the proposed reserve fund designations. Personnel reserve, I would like to increase that to 123,700. And that is the equivalent to 4/11ths of a current payroll. Operational reserve, this includes an increase of 510,900. And that just brings us that much closer to our current 3-month cash flow target, which is about 2.8 million. So we're getting there. Then the last area is the capital reserve fund. I propose that we keep that at $200,000. And that is just for future capital needs. I know we're looking at needing new roofs, I believe in our mountain home office, and new cooling tower, which is going to be about $72,000. So I would like to keep that at that level. So with that, I would entertain any questions.
Madam Chair, Ted Epperly, just a quick question for Bonnie.
Go ahead.
Yeah, Bonnie, just help me understand on the personal reserve fund why you are taking it to 4/11ths. Is it just the sequential payment of 1/11th and now we're at 4/11ths, or are you accelerating the amount being put into the 11/11ths?
No, your first statement is correct. Every year we increase that incrementally for another year's share of that. Being that we only incur that cost every 11 years, we started this fund 3 years ago, so we put in 1/11th that year, another 11th the next year. So I've been requesting the board to add like 1/11th each year, so it'll be fully funded by the time we incur that 27th pay period.
Okay, thank you. That clarifies it. We're at 4/11ths then with this payment that you're proposing. Yeah, thank you.
Yeah, thank you.
Thank you, Bonnie. Any further questions for Bonnie? Okay, this is an action item. We do require a motion. If somebody would please step forward and do that.
Madam Chair, this is Elt.
Yes, Al, go ahead.
I want somebody else to make the motion. I make too many motions.
See if I can word this right here, Madam Chair. This is Commissioner Sturm.
Yes, Ryan, go ahead.
So we're just making a motion to approve the fiscal year 2021 carryover and reserve fund proposal. Is that correct?
Bonnie?
That is correct.
Okay. I so motion.
Okay, thank you, Ryan. Is there a second to the motion?
This is Jane Young, second.
Okay, thank you, Jane. Any further discussion? Hearing none, I'll call for a vote by county, starting with Boise County,
Commissioner Sturm, aye.
Valley County,
Commissioner Hasbrook, aye.
Ada County,
Jane Young, aye.
Ted Epperly, aye.
I believe Diana's not on yet. Elmore County,
Representative Blanks, aye.
okay, motion carries. Thank you, folks, and thank you, Bonnie. We'll proceed on with the 2021 financial report. Bonnie, are you there?
Sorry, I was babbling on and didn't hit my unmute.
That's okay.
Sorry.
It's all right.
Yes, I am here. And this report, of course, it's just for the first month of the current fiscal year 21. Before I start this, though, I just did want to remind the board that our fiscal year 21 budget does not include any impact of COVID activities. At the time that the budget was prepared, we had no reasonable estimates of the budgetary impact, so we decided to exclude it entirely. So the mid-year budget revision will include significant changes to account for those activities. But now to go over this report. The end of July is 8.33% of the fiscal year, and this report shows total revenues at 15% and expenditures at 9%. A few noteworthy things I wanted to mention. Of course, if you look at contracts, they are high. And this is pretty much the result. I believe it was Dr. Epperly who asked about COVID subgrant funding. You can see community and environmental health is at 31% already. That is the result of new subgrant funding in our EPI and public health preparedness programs for COVID activities. Family and clinic services is also high. That's primarily just with the timing of revenues. Other revenue is already at 67%, but that is because in community and environmental health, that figure includes our full payments in the state for the Millennium Fund this year, for Citizen Review Panel funding, and also for the Western Idaho Community and Community Health Collaborative, our WICHC funds. Let me see. I'll jump down to expenditures. Again, you can see in personnel, in total, we're right on. But again, community and environmental health is high. That is because of all staff efforts being pulled from their normal programs and divisions into the COVID response. So they're coding to our EPI and PHP programs in community and environmental health. Administration is just a little low. Capital outlay, that payment or the amount of $146,868, that is the final payment for our Boise office remodel. So I appreciate the flexibility or the use of our reserve funds for that. The next page, Dustin, page 2. Again, looking at fees, I just wanted to point out this again shows that positive trend we're seeing. You can see in both community and environmental health and in family and clinic services, fees as of July this fiscal year are a little bit higher than they have been the prior fiscal year, or even in environmental health the prior 2 fiscal years. So Dustin, if you go to the next page, our cash balance statement as of the end of July. Our cash balance is high. Total cash is at $3,733,570. Undesignated cash balance based on the reserve fund designations approved prior today leaves $1,740,229. And again, that balance is high because we just received half of our our standard state general fund appropriation, plus all of the Millennium Fund, the Citizen Review Panel funds, and the WICHE funds from the state. Are there any questions on this report?
Madam Chair, this is El.
Yes, El, go ahead.
Bonnie, I don't know, maybe I asked you this in the past, I don't remember the answer. In the counties, we are able to code our COVID expenses and get reimbursed through FEMA. Is the House District, do they qualify for that funding as well?
I have not seen any FEMA funding directly, no.
How about the CARES Act?
I'm sorry, the what?
The CARES Act?
The CARES Act. Yes, excuse me. The CARES Act, yes, that is available to the public health districts. What we have been instructed by the Division of Financial Management is, and the Controller's Office, is the CARES Act funding is available to us once we have expended all other sources of funding. And we have not hit that yet.
Right.
We were approaching that, but then we received quite a large EPI subgrant. So we have not utilized that yet, but that is available.
How big was that EPI grant? Do you remember?
In total, gosh, for our health district alone, in total, we're looking at up to $6 million.
Oh, nice. Very good.
Yes.
Very good.
It's huge.
Yeah, we've got our bases covered then with that, knowing that's available.
We certainly should. I believe so. There have been so many different funding streams, and I've really relied heavily on Michelle Hanrahan, our financial specialist principal, to juggle all those. She's doing a great job of that. But yes, that EPI funding is huge.
Yeah. Good news.
Definitely.
Any further questions for Bonnie? Well, hearing none, Bonnie, thank you so much for your report today.
You bet. If I could just take 1 minute. I don't know if Russ has announced. Sorry.
Go ahead.
I don't know if Russ has announced to the board or not, but I did submit my retirement notice to the agency. So I will be on board full-time through the middle of October, and then very part-time and burning leave kind of through December. But so I will see the board at the next meeting, or at least see you remotely. But I just wanted to let the board know it's been an absolute pleasure working with you, and I've enjoyed the opportunity at Central District Health, working with Russ and all the staff here. It's a great agency. I feel very fortunate to have ended my career here.
Well, congratulations on your retirement, and we feel very very fortunate that we have had you as our financial director here. So I congratulate you on opening this new chapter in your life, and we'll look forward to working with you probably for a few more months.
Thank you.
Thank you, Bonnie. You've done a great job.
Thank you very much.
I don't think we approved that retirement, Bonnie.
Okay, thank you. And hearing no further questions for Bonnie, we will move on with our agenda, which is an update on our strategic plan for 2020 by Russ.
Thank you, Madam Chair. Dustin, can you pull up the status report? for strategic plan? Okay, thank you. Can you enlarge that a little bit? Thank you, perfect. Okay, what I want to start with is, as you may recall, we had a fairly major revision to our strategic plan, presented it to the board, had conversations leading up to December. It was approved, and this strategic plan began in 2020 through 2023. This document that you're looking at is very high level. So we got 3 priority areas and then goals under each of those priority areas with objectives. And I believe it was the board's interest in the past to keep it at this level. I just want to share with you, there's a very detailed work plan with individuals who basically own the various sections that support each of the objectives. And I'd be glad to provide that to you upon request, but I know you're interested in the high level activity. So that's what I'm going to focus on today. And again, I wanted to just say, you know, we started this really in January of 2020. And as all of you know, on March 13th, a Friday, everything really changed for us, really here in the United States and in Idaho, and in our district in particular. That March 13th date was the first COVID-19 case in the state of Idaho. So just for your awareness, a lot of the staff who are fully engaged in supporting the goals and objectives for our strategic plan are also part of our Health Department Emergency Operations Center. So to say that our traditional business has been disrupted is an understatement. And I just want to emphasize how pleased and proud I am of all of our staff here for the work that they've done to keep our operations going at least at a in some instances bare minimum levels, but to continue to serve our communities in the various program areas, from clinic to land development to food inspections, as well as our public health preparedness and epidemiology teams who do this kind of work, but definitely not at the level we're looking at today. I think our epidemiology team, Bonnie just mentioned that $6 million grant. There's a lot of new faces here helping us out. We've had great support from the governor's office. We've also had great support from the State Department of Health and Welfare and the Division of Public Health in terms of even providing staffing to us to help us through this most recent significant wave of cases. So I just want to put that out there. I know you all are very well aware of our efforts and the work that's being done here. So I'll start with priority area efficient, integrated, and quality services. So that's an area where I think we're doing well. We're mostly in the green as far as the traffic light, with a few in yellow. So, for example, objective 1.2, expand telehealth services to Elmore and Valley County. We have the equipment, we have the software, and we were really in a kind of a full steam ahead, and the timing was really good to implement. The timing was really bad as far as actually being able to execute it when the staff, when things really got disrupted. And I know just in the primary care community more broadly, the challenges faced with having the ability to see patients, but also keep staff and patients safe. So that was our experience for sure. Objective 1.3, and I'm not going to go through all of these. Like I said, you can see it here in front of you, and we'll scroll down. WIC participation for a couple of years statewide, nationally, has been declining. And I think part of that is it's an income-based eligibility program, and the economy was doing quite well. Well, things changed dramatically in March, into April and May. And again, talking about being proud of our staff, most of our staff in WIC are now working from home, and they're doing their client visits virtually. And of course, we're all hopeful that'll shift back to in person at some point, but that's a great deal of uncertainty right now. So it's just been really, really disruptive, and our managers, not only in WIC with Emily Wadoops, but across the agency, helping keep staff engaged from using technology like we're using today. So very, very good good results we're getting. We're able to still meet the needs of the families. We, again, another fortunate situation is we shifted over to a debit card, so we don't have to issue checks anymore, and that happened last summer and last fall. We were the first district to pilot that. So that's working, like I said, exceptionally well. And then under Goal 4, Objective 4.1, we have been fortunate to receive funding for various opportunities, including grants to support 3 staff to attend a value-based care training at Boise State University. But I wanted to highlight one in particular, because it's I think it's the largest grant we've ever received, and that was out of our health promotion and health policy group. They just received a $1 million 3-year implementation grant for the opioid prevention, education, and outreach work we're doing in Valley County. So that, to me, is a really huge deal. And again, I think it speaks to the commitment of our staff. I would tie it back into the conversation we had with Mike Kane a little bit earlier on in this agenda. They're doing an exceptional job in spite of the fact that they're doing their job, plus they're doing additional work, considerably additional work with the COVID response. So I just wanted to highlight that, and that is for Valley County, and that particular grant is a follow-up to a planning grant that we had received a few years ago. So to me, it's really exciting to be able to continue to move things forward in public health and in areas besides COVID. Dustin, if you want to scroll down to the green priority area, skilled and engaged workforce, scroll down a little bit more. So this, among many challenges we have faced here at Central District Health, one big loss was the passing of our human resources manager in April. And clearly, skilled and engaged workforce is one of the areas that was on her plate to work on. And that's why you'll see the asterisk there. It took us a while with working through the state to get the position announced. And we have Gary, who you met a little bit earlier, on board now. So we're going to get this definitely back on track. Gary's plate is obviously overflowing with all the new staff we're bringing on and the turnover there. So I am making a commitment. We're not going to lose sight of the importance of this. I think part of that recruitment and retention will involve, if we can get some things heading in a positive direction around the board's commitment to ensuring our staff get compensated appropriately for the positions and the high performance that you're seeing right now. If you want to scroll down, Dustin, to the final.
Can I ask a question real quick?
Sure, you can.
And this is just it's a question that would lead to a further discussion down the road. But as it relates to getting folks hired and some of the challenges that we've had, and hearkening back to Mike Kane's discussion about are we a state agency, are we not a state agency, et cetera. There's nothing in code that would require us to work through state of Idaho human resources process. Is that correct?
Madam Chair, this is Russ.
Yes, Russ, go ahead.
Yeah, Commissioner LaShionda, that's a great question, and I'm glad you brought that up. So we are required to comply with. Does that mean you have to use? Does that mean you have to, everything has to be processed through the state? And I think that still needs to be determined. You know, for somebody to have to comply with something or conform to the standards, does that actually mean you must use that system? And again, I think that's something that we're going to need to work through, because I'm guessing you're thinking about some possible alternatives, possibly even working with our counties to help, you know, with job announcements and recruitment and things like that.
Yeah. So I think we'll need to work through that, but it's especially timely, as I know getting our disease investigators has not happened maybe as quickly as we would have liked or hoped. So I'll look forward to that discussion. And I guess the problem solving around that may need to happen sooner rather than later.
Right. And Madam Chair, I'll continue. I do agree with you, Commissioner Lasciando. That's what I mentioned as a pressure point earlier on in our conversation. Is one of the challenges you have is when you're bringing people on part-time temp unbenefited versus limited service agreements. And what a limited service agreement would look like is these staff would come on, they would be accruing credited state service hours, they would be benefited. That's when we have to work through the other process that makes it more difficult. So again, speaking to that, in order to try to reduce the turnover we have with part-time temps, we're looking at making those, putting those people into classified limited service arrangements. So with the idea that we want to keep them on for a longer period of time. And again, you know, all of us on this call, and hopefully the public who are watching this is not a month or 2 months more effort, especially in the public health area. It's just going to, I use the term shift as though it's going to move away from something. It's not. What we're going to do is we're going to get more work put on our plate, and we're glad to take that on. Of course, that's part of our responsibility. Speaking of vaccine distribution, administration, and management. So I'll go on to the final priority area, reliable community partner and health advocate. And again, the staff that are very involved in all three of these goals are heavily involved in a COVID response here at Central District Health. The one area that is yellow, but I feel like we're making really good progress, is the Western Idaho Community Health Collaborative. We were very fortunate to have that funded for a second year through the state legislature. This is a partnership with Public Health District 3, so we're serving the 10 counties of Western Idaho. And the work itself of the collaborative is going exceptionally well. We have a funding council and that oversees kind of the budgeting part of it and the money management, and then we have the full collaborative made up of representatives for the 10 counties. The one area that I don't know if I'd call it struggling, but it's just more a matter of the revenue side of it, is a lot of our partners have made funding commitments to us, and we were hoping to be able to build that, but many of them work in healthcare, and certainly they're being impacted by the COVID response, and so that's where we have opportunity for improvement, and that's why that's in the yellow category. So that's all I wanted to cover. And again, I can provide more detail about any of these if you have questions, or I'd be happy to provide you a copy of the work plan, which includes everything, including narratives about the specific work for various strategies to support this plan.
Okay, thank you, Russ. Any discussion regarding the strategic plan report? Well, hearing none, the next item on our agenda today is adjournment. So
Betty Ann, this is Ted Epperly.
Yes.
I'd like to ask one question before we adjourn, if I can.
Okay, go ahead.
Yeah, thanks. And we don't need to take a deep dive into this now, Ross, but perhaps at some later point you can bring back what I'm sure you must be working on which is an operational plan around COVID vaccine distribution once a vaccine becomes available. It's going to be a pretty big deal in regards to getting vaccine out to citizens. Obviously, the public health department will play a part of that, not all of that. It'll be up to many community health partners and pharmacies and a bunch of things. And I remember in the past, Russ, with the H1N1 vaccine, when we set up distribution stations in terms of vaccination for the community. So just one thing to put on the radar, Russ, maybe you could make a short comment now, but at some point, and I'm sure you and the staff are starting to look at an operational plan of how do we get this out. It'd be great to know as the board kind of where things stand with that. And I'll stop.
Madam Chair, this is Russ.
Yes, Russ, go ahead.
Yeah, great point, Dr. Epperly, and that is something we're working on the operational plan and working very closely with all of our community partners. We're definitely not looking at doing the point of dispensing clinics, the mass point of dispensing clinics like we did with H1N1, but rather work very strategically and targeted with the healthcare, with pharmacy, with long-term care facilities, with emergency management, emergency response, et cetera, et cetera. There'll probably be some closed pods, what we call, where vaccine gets prioritized to high-risk groups, for example, or people critical to the response, such as healthcare workers. So that's we're right in the throes of that. And for a future meeting, what I would suggest is we'll maybe invite our public health preparedness program manager, Natalie Bodine, to come and provide an overview of that in anticipation, as you know, of what's to come.
Madam Chair.
Thank you, Russ.
Yes,
This is Diana. This is as much for the public as anyone else. I think there's been a lot of questions and concerns, and we already, I think, have maybe a significant amount of vaccine hesitancy in Idaho, and some concern that that'll be even heightened with this potential vaccine. And Russ and I had the opportunity to be on a call with Dr. Hahn, different Dr. Hahn, the FDA director, Dr. Hahn. And he explained really what the process is for this vaccine development. And I think there's been worry when we hear the term Operation Warp Speed, that somehow corners are being cut. It's not the usual protocol. And I was really reassured to hear that's the complete opposite of what's going on. They are adhering to all the exact same rigorous protocols. But what's happening is that they've enrolled 5 times the number of people in the vaccine trials than typically. So I think we're going to be able to have really great confidence about the vaccine when it does come out.
Okay, thank you, Diana. Any further issues that we need to talk about before we call for a motion on adjournment?
Madam Chair?
Yes, Megan, go ahead.
Motion to adjourn.
Thank you. Do I hear a second?
Madam Chair, it's Commissioner Sturm, I second.
Thank you, Ryan. No further discussion regarding the motion to adjourn, I trust. So we will go ahead and call for a vote by county, starting with Boise County.
Commissioner Sturm, aye.
Valley County.
Mr. Hasbrook, aye. Good to see everybody.
Ada County.
Jane Young, aye.
Ted Epperly, aye.
Commissioner Laciando, aye.
Elmore County.
Representative Blanks, aye.
Okay, thank you. Motion passes. And for the public's information, our next meeting will be Tuesday, September 1 at 4 o'clock p.m. So I want to extend a thank you to everybody that has participated in the meeting today and for the public that has joined in virtually. So the meeting stands adjourned, and have a wonderful day, everybody. Thank you.
Thanks.
Yep. Have a good day, everyone.
Be well.